is very important to the Puerto Rican community. As we move to turbulent times, we really need to figure out solutions for the people who are in great need in our communities. The jobs are getting more difficult to get, and the pathways to economic opportunity are elusive through our communities. So the focus of this conference, I think, is very timely, and it's very important to us. On behalf of the Center for Puerto Rican Studies, Hunter College, it's my pleasure to welcome you all to the event. We have a long day. I'm happy to see that all our researchers made it through the weather and all the other perils of last-minute conferences. But let's get going with the conference. It's somewhat of a long day, and I really appreciate that you're taking the time to be here to discuss this topic. It is my great pleasure to introduce a good friend, a good supporter of Centro, Dennis Rivera. It's a man who needs very little introduction in this crowd, but let me say that for many years he built up the 1199 as one of the most powerful health unions in the country, and now he's replicating that at the national level. Dennis has been quite active in healthcare reform, trying to influence our senators, and the last time he spoke in one of our conferences, he said we have 2 senators down, we need 58 more to go. I think we're closer now to the 60s than we were before, and we want to hear all about what he has to say about job opportunities in the new economy, in the current situation as we move forward out of the recession and so forth. Dennis is also, for those of you who are not aware of Centro's new impetus to rethink what we do and how we do it, Dennis has been an instrumental leader bringing others to help us figure out, through the strategic planning at Centro. So it's my great pleasure to introduce my friend, Dennis Rivera.
Before I go with my presentation, I'll be brief. But I have to say that I've always been an admirer of El Centro way back, and I have to tell you that there was never an opportunity, I think, in the history, at least from my humble opinion, from the Centro's perspective, to make a bigger contribution to our society, particularly for the Puerto Rican community, than at this moment. I'd like to share with you that yesterday we had a board meeting of the Centro Advisory Board, and we were so incredibly excited about the kinds of opportunities and role that the Centro could play, particularly at a moment that we are now, because of the economic crisis in Puerto Rico, we for the first time now we have a majority of the Puerto Ricans living in the United States, and the reality, and I believe that unfortunately, at least from my perspective, this trend is going to remain, and our numbers in the United States are going to dramatically grow out of this deepening recession in Puerto Rico. So in that sense, I think El Centro has to step up and play a bigger role to interpret the Puerto Rican reality to Puerto Ricans back in Puerto Rico, and particularly to others in the United States, whether it be the funders, the policymakers, the media. So in that sense, I see El Centro playing a larger and larger role that has ever played, because the moment merits it. So in that sense, I want to thank you for collaborating with El Centro, because I think that the Centro's work, the best is yet to come. That's my perception. I want to thank all of you who worked very hard to make this happen. I want to talk today about one of the visions about the unfolding opportunities for Boricuas, Puerto Ricans in the United States. In many ways, this has been a heady years for Puerto Ricans. The appointment and confirmation of Supreme Court Justice Sonia Sotomayor seemed like a surreal dream come true. And as we watch Esa Boricua del Bronx take her oath for one of the most elite and powerful positions in our country, I come from Ay Bonito, I could not help and be amazed how far we had come. But then we came back to earth and remember the harsh reality of daily life for the majority of Puerto Ricans in this country, and realize how far we have yet to travel on our collective journey. But it would be hubris for us to come to Hunter College Center for Puerto Rican Studies to lecture you on the demographics, economic, and social characteristics of Puerto Ricans, so we won't dwell on this. However, we all know, both in the States and in the island, communities have continued to struggle with this economic crisis. Things seem to be getting worse, not better. Despite the seeming advantages of citizenship and longevity, even before the economic crisis, the 4.1 million stateside Puerto Rican lag other Latino groups and the U.S. population as a whole on several key socio-economic indicators. For the 3.9 million living in Puerto Rico, the picture is even worse. Nationally, 22% of Puerto Ricans living stateside struggle every day trying to make life under the federal poverty line, compared to 13.2% of the general population and 19% of the overall Latino population. In Puerto Rico, the poverty rate is a staggering 45%. Very dramatic. The poverty statistic closely mirrors the income statistic for Puerto Rico, for Puerto Ricans. In 2007, the median household income for Puerto Ricans in the state is $38,500. In Puerto Rico, $18,000, compared to the $50,000 on average. This troubling statistic can be attributed in large part to Puerto Rican lower educational attainment. On average, only 64% of Puerto Ricans in the States and 66% of those in the island graduate from high school, compared to 84% of the overall population. What we're interested in discussing this morning is what we have been seeing as opportunities in the horizon that give us reason to hope for a better future for working families across this country, particularly Puerto Rico. First, to state the obvious, the historic election of Barack Obama marked a new era for us. For the previous 8 years, Puerto Ricans and working families in general were struggling to survive in an economic and social policy climate that was indifferent, if not outright hostile, to the economic and financial needs and aspirations of the bulk of the American public. On the contrary, we suffered under an administration that put profits over people and took us to the levels of income inequalities not seen since the days of the Great Depression. However, President Obama is striking a different course. He told us, we need a president who sees government not as a tool to enrich well-connected friends and high-priced lobbyists, but as a defender of fairness and opportunity for every American. From the first days, Obama has focused on a more inclusive view of government, saying, the question we ask today is not whether our government is too big or too small, but whether it works, whether it helps families find jobs at a decent wage, care they can afford, or retirement that is dignified. The Obama administration has been working hard with many partners, including labor, on a number of initiatives that presents enormous opportunities to make a difference in the lives of working people. In fact, the first law he signed when he came into office was the Lilly Ledbetter first, the fair pay. Since then, the administration has worked on a wide range of efforts to build a sustainable economy as we recover from the current crisis that will expand employment opportunities, including for low-wage workers. For example, on the one hand, investing in a new green economy will add many more jobs, while they plan to transform our nation's educational system, especially support early education and improve failing schools, many of which are in our communities, should better prepare the nation to take advantage of new job growth. Today, we want to focus on two specific opportunities coming down the pike from our nation's capital that we believe will transform the landscape for low-wage workers, the Employee Free Choice Act and healthcare reform. It is up to us to make sure that first, our community has a seat at the table in the development and implementation, and second, that we start preparing right now to take advantage of these historic developments. It is a well-known fact that the best anti-poverty program in history is unionization, and it doesn't cost the government a dime. As a matter of fact, those who have study the history of the United States, basically we attribute the American labor movement, particularly after the Second World War, when the countries around the world were decimated with the basic creation of the American middle class. If you remember the auto workers, the steel workers, the rubber workers, and basically that's how we came to know the American middle class in the United States. But now, unfortunately, that's not the reality. Unionization not only provides the benefit of giving workers a voice on the job, but collective bargaining also has clear, demonstrable economic benefits. By forming unions, many workers increase their opportunities for advancement on the job by establishing job ladders and professional development and training programs. However, over the last decades, a combination of economic and political forces, particularly the Republican right wing, has made organizing into a union increasingly difficult for workers. Federal enforcement of worker protection has gotten systematically weaker, and employers have gotten increasingly sophisticated in with their union busting tactics. In Puerto Rico, for example, the governor is waging a full-fledged frontal attack on workers, suspending a host of labor rights and worker protection. Workers are in an increasingly uphill battle to unionize because the current system is broken. It is simply too easy for an employer to retaliate with legal firings, intimidation tactics, and smear campaigns with almost no accountability under the law. The Center for Economic Policy and Research estimates that the typical low-wage worker who is in a union earns 25% more than a worker doing the same job who's not in a union. Union workers in the medium and high wage brackets also earn more than the non-union workers. But note that the union wage advantage for low wage workers is even stronger. With regard to low wage workers specifically, unionized workers in the 15 lowest wage occupations are 25% more likely to have health insurance than similar non-union workers in the same occupation. And union workers in low wage occupations are also 25% more likely to have a pension plan. We have an opportunity to be proactive and level the playing field for workers across the country by passing the Employee Free Choice Act, which is supported by President Obama, and the question is getting 60 votes in the Senate to get it passed. The Employee Free Choice Act will rebalance the system between employers and workers and restore workers' freedom to organize unions. This reform will set the foundation for millions of low-wage workers, including Puerto Ricans, to get a real voice on the job and bargain themselves out of a dead-end job. I'm sure it's no news to everyone that we are finally on the verge of winning comprehensive healthcare reform. On that note, we expect that before the 24th of December that the Senate is going to pass this legislation, and then after the new year it will go into conference, and then before the State of the Union we hopefully will get this enacted. As the chair of the nation's largest healthcare union, representing over 1.3 million healthcare workers, I cannot overemphasize how important this is going to be, not just in terms of how many people in this country will finally breathe easier, knowing they have affordable, reliable, high-quality healthcare, but also as a fuel to increase the rate of job growth in what is already one of the fastest growing sectors of the labor market. And most importantly, many of these jobs are good jobs with room for career advancement, and we are going to make all of them better. The healthcare sector represents about 16 to 17% already of the American economy. It has been one of the few sectors, and I want to repeat this, it has been one of the few sectors that has not shed jobs during this terrible recession. It has not shed jobs during this terrible recession. On the contrary, according to the Bureau of Labor Statistics, the healthcare sector added 613,000 jobs since the recession began in December of 2007. In fact, among all the occupations in the economy, healthcare occupations are expected to make 7% of the 20 fastest growing occupations, the largest proportion of any occupational group. The 7 high growth healthcare occupations will add nearly 750,000 new jobs between 2006 and 2016. Moreover, the 10 jobs with the largest number of new positions, 4 are in healthcare, led by registered nurses at the top of the list, followed by personal and home care aides and home health aides ranked at 6 and 7, and nursing aides, orderlies, and attendants at 10. Overall, the government category of of healthcare and social assistance, which includes public and private hospitals, nursing and residential care facilities, and individuals and family service, such as home care, will grow by 25.4% and add 4 million new jobs. Healthcare reform can be expected to accelerate this growth even further, as 36 million more Americans will become insured and roughly $450 billion in new money are invested in this sector. As coverage grows, so must the healthcare workforce. Today, there are already chronic shortages in almost every area of healthcare, from primary care physicians to nurses to long-term care workers, and many of them are in predominantly Puerto Rican areas. For example, 1/3 of Puerto Rico is in a health professional shortage area. Of the 84 places in the states that have population that are more than 10% Puerto Rican, 82% are in counties that have been designated health professional shortage areas by the federal government. While this is not good news with respect to healthcare access for Puerto Ricans, it demonstrates the extent of unmet demands and potential growth in healthcare jobs in these communities. This is particularly significant shortage of bilingual healthcare workers, and the need for Spanish-speaking staff is expected to grow as Latinos grow as a percentage of the population. The chart shows that Latinos lag behind other ethnic groups in New York when it comes to participate in the healthcare workforce. For example, in New York City, some place that I know better than anywhere else in the United States, while we are close to 30% of the population, we only have 1.5% of the nurses are Latinas. And of the 100% doctors, we only have close to 2% doctors. So clearly we are completely and totally underrepresented in those areas. And there's a lot that we could do there. And by the way, this is one thing that I want to put as a challenge to Edwin and El Centro, which is that basically working together with schools in the different areas, we could literally fight to try to create fast-track programs so we could train more nurses, more doctors, and that's the kind of advocacy I believe that this moment calls for, because the people are you know, well, let me keep on. Overall, Puerto Ricans and Latinos generally are underrepresented in the healthcare workforce in the United States. Latinos comprise around 10% of the total healthcare workforce, but 15% of the population. We estimate that there be approximately 100,000 Puerto Rican healthcare workers among the nearly 1 million Latino healthcare workers in the U.S. A larger, stronger, diverse, culturally competent workforce is crucial to building a healthcare system that works for everyone. With these changes in the horizon, and you know, not that we're tooting our own horn here. When I was seeing this, I said, "Oh my God, we're only talking about ourselves." But what I wanted to use this was as an example, of something that we have done that we could use, and that was the only purpose as an illustration. With these changes on the horizon, it's critically important that we as leaders of the Puerto Rican community start planning immediately for how we will take advantage of the job growth opportunity that healthcare reform will create for the benefit of those who need them the most. While the healthcare sector includes a number of high-wage occupations, the entry level is dominated by low-wage occupations, including certified nursing assistants, called CNAs, home health aides, and licensed practical nurses, LPNs, which each rank within the federal government 15 low-wage occupations. But the good thing about the healthcare industry is that it does lend itself to create job ladders, and this is what we have been doing. We have succeeded in designating and implementing training and operating programs that have taken minimally skilled entry-level workers like home care and brought them up through the ranks all the way to high-paying registered nurse positions. Our program, called the 1199 League Training and Employment Fund, is a labor management partnership that is the largest training organization for healthcare workers in the United States. There are about 500 participating employers and approximately 200,000 covered employees throughout New York State. The goals of the fund include achieving quality training and education for our members, meeting the changing demand of the healthcare industry, providing quality care for patients, and promoting growth and empowerment in the workplace by ensuring workers a stronger and more secure position. Over the last 10 years, we have collaborated with labor, management, education, and community partners to develop strategies to train the incumbent workforce as well to being unemployed individuals into the healthcare workforce to fill needed jobs. What is pretty unique about this model is that its approach has been to develop career ladders, moving individuals through a system that builds on skill, knowledge on the job, and a dedication to the industry. Employers, the union, and educational providers understand that an investment in the incumbent workforce benefits all stakeholders, as employers will fill vacancies with dedicated workers who have institution-specific experience, a track record of success, and longevity in the healthcare industry. Our program has created national models of educational programs for healthcare workers, pioneer learning using the materials of the job and the requirements of the programs to teach workers who in other programs would not have been included due to low-level reading scores. Our program has also designated a model to prepare foreign trained nurses to work in the United States. Around 14,000 individuals enrolled in our program annually. Of these, approximately 12% are Latinos and about 92% are people of color. The majority of enrollees are working in entry-level positions in the industry. In 2009 alone, 100 participants earned their GEDs, 1,000 graduated from either 2 or 4 years or graduate degree programs, and over 800 individuals graduated with RN or LPN credentials. Looking at our nursing graduates, 80% moved from entry-level position care, where they earn an average of $12 to $14 per hour, to earning starting salary of $60,000 a year as a registered nurse. And by the way, a member of our organization who's a registered nurse, and I've seen it, I know them, starts at $60,000, and with the differential pay, which is depending on what shift you work, on what unit do you work, it's common to have people who make $80,000, $90,000, $100,000 as a registered nurse. Graduates from the training fund achieve degrees in technical and professional areas where there are shortages and where a job upgrade is virtually assured. Pre-college students move into a college-level program. As a result of the supportive environment, including targeted academic support, such as tutoring and case management, and even childcare, and labor and management partners that support the incumbent workforce with release time and opportunity to upgrade this program, boosts an overall 85% retention rate and a 75% upgrade rate, outpacing similar programs. I believe that even the Hunter program is hovering around 35 or 40% of people who enrolled and those who finished. So this is the kind of mentoring program that I believe that we need, because the question is not who enrolls, it's who finishes. Both. We need to deal with that. Our program has created a system of workforce development in the healthcare industry, unequal in its ability to provide opportunity for entry-level workers, the majority of whom are people of color, to succeed in the fastest growing industry in America, where they have further opportunities for advancement. In the midst of this economic and job crisis, we do see hope and a lot of opportunity for Puerto Ricans and other predominantly low-income Americans on the horizon. While it is true that the economists continue to warn the so-called jobless recovery, we believe that the healthcare industry in particular can offer not only jobs, but a way for hardworking people to work their way out of poverty with the right support. We have found in our own work that a good paying job with a future in healthcare is not the elusive dream so many people think it is. We know how to take a largely unskilled home care worker who dropped out of high school and provide the right support, the right curriculum, the right incentives, and help them to flower and grow out of their low-paying jobs and become a professional. And the beauty is that for the foreseeable future, these better jobs will be there. I have a line here that I don't know, is that true? These are not jobs that are not going to be shipped across the ocean. That is not true. The reality is that some of those jobs are being shipped across the ocean. Right now, in our hospitals, I'm seeing, for example, X-rays and MRIs and all that stuff being sent to be read in India or to be read in England and being sent in other places. And in addition to that, billing through the communications that are being done in the Caribbean and in other areas. And the other thing that is being happening is the exporting of the patients where they basically they compare, because of the high cost in the United States of the delivery of healthcare, rather than taking care in New York City, they go to Mexico to take care of their healthcare needs. So, and to India and places like that. So that is not that. That might have been true at some point, but not now. The training program has hit on something very special, and that is the graduation ceremony is one of the most inspiring events that you will ever see. The enormous pride and belief in a better future for their children is palpable in these graduates, and there is never a dry eye in the place. And I gotta tell you, it is for me amazing in the sense because to go back to school as an adult, particularly if you are a single mother, and then dealing with the logistics to who takes care of your kid while you go to work and then you go to school, and then the logistics of doing your assignment and your homework and staying in it and sticking with it. So everybody who start here and get through here basically goes through an incredible journey. And that day of the graduation is an incredible celebration of all that hardship that has taken place. And I have to say that when it takes place, there's not a dry eye in the place. It's one of the most wonderful, wonderful opportunities. When people celebrate that they were a home care worker who had no education, now they're a registered nurse, not only that they're going to have a high degree of income, but they have an incredible achievement that they can pass it on to their kids in terms of, if I can do it, you can do it too. So we invite all of you to come and take a look at this program, because, and the question is how we can replicate programs like this in the earmarked or targeted to Puerto Rican and Latino community. Because this is exactly the model we need to replicate across the country to make sure that everyone and every Puerto Rican has a pathway out of his or his dead-end job and to a better future. Thank you so much.
Thank you. The difference between visionary leaders and the rest of us is that they raise the bar. And for today, we're going to try to answer some of the challenge that Dennis has put in front of us. In the meantime, I think Dennis can stay a little bit and take a couple of quick questions if you have burning issues that you might need to address. This is the time to ask, if you don't mind, Dennis, one of the questions. Yeah, yes.
What opportunity do you think that virtual education provides for replicating a program such as this one?
I think that by explain a little bit virtual education. What do you mean by that?
I think it could be different things. Online learning,
right.
Also live interaction with a remote teacher that is somewhere else. With partners that attract, with partners in Latino communities around the country that attract the home-aid workers because, they either work with them or are in the community of the home-aid workers. With partners such as 1199.
Well, let me tell you, it's an enormous opportunity. And let me tell you why. As healthcare reform happens, there's going to be a whole re-engineering of the healthcare system. And that re-engineering of the healthcare system is going to be based on trying to get better outcomes for our patients. And by that it means, and not that I'm going to get in the weeds, but it means, for example, if a patient goes for a hospitalization and has a surgery, 30% of the patients go back before 1 month to be taking care of them. So what we have proven them, what we have learned is that if we have people who go to their homes and follow up to make sure that they take their medication, to make sure that they get out of the. So there's a whole what is called the community healthcare teams, and the same thing in terms of prevention. One thing that the healthcare system in the United States is a system that is geared to take care of people who are sick, not to prevent people from getting sick. So there's going to be a slew of different professions. Professions that are going to be ones that are going to be the ones who basically are going to be the ones who educate people but don't touch the patients, advocates. There's going to be professions that are going to be the ones who literally touch the patients. Those are the ones who go to people's homes to help them check their blood pressure, blah, blah, blah. But there's going to be and the healthcare delivery system is going to come out of the hospitals and go into the communities and into the the people's homes, and in that sense, there's going to be a whole new jobs that are going to be created. As a matter, the fastest growing jobs are going to be in that area. So having a strategy to tap into that is going to be important. And particularly, if you remember seeing that chart that says that we basically are almost non-existent in the healthcare provider system. As Latinos, we can make the case, that it's better for the healthcare system that somebody who is linguistically competent, a Spanish-speaking person treating a Spanish-speaking patient. So in that sense, enormous opportunity. The question is developing those strategies and dealing with that. And by the way, there are grants right now that will be available either from HSS or the Department of Labor to help do that. And what we need is leadership of people to do that.
I can take one more question. Wait a minute. Let me go there again, and maybe we'll take one more and cut it quick.
Yes, based on the research you've conducted, have you looked into how it negatively impacts the recruitment of Latinos, especially in Puerto Rico, in the United States, how it's negatively affected the islands, mainland? Because I taught for 11 years in Puerto Rico at the college level and was ethnically there, and a lot of students, those that were bilingual, were looking forward to just completing their degree because they already had a job offer, and then that affected negatively our healthcare in Puerto Rico.
Right. Let me tell you about, and by the way, I would love to share that report. Did I share with you the Vanderbilt report about the future planning of the healthcare system in Puerto Rico?
Yes.
Yeah, and I think that would be great if we could share with people. And I have more copies. So we conducted a seminar in Puerto Rico about with North American experts and the University of Puerto Rico about the healthcare situation in Puerto Rico. And what we discovered, it was a dramatic problem. But getting back to your question, that could be the subject of another presentation. It's basically that there's a massive exodus of Puerto Ricans out of Puerto Rico, and those who are leaving are particularly the professionals. That basically you buy a $200 one-way ticket, you could even get it cheaper, and basically land in New York and get a job that would basically, first of all, you don't need a visa, as we all know as Puerto Rican because of our American citizenship, and you land in here and you can basically get a job in here making 3 or 4 times what you were making in Puerto Rico. And in a place that basically doesn't have the high level of crime that you have in Puerto Rico right now, which is, by the way, I would invite you to take attention to that. I have I look forward to retiring in Puerto Rico, so I have a house in Puerto Rico. I spend a lot of time there, and to be honest with you, when I go there, no one, to the contrary, when I go there, from the moment I land is somebody le dieron un tumbe, le dieron un carjacking, pasó aquello, pasó lo otro, and that my experience here in New York, at least in the circles that I move in, where our union colleagues, I don't, people don't tell me me dieron un tumbe, or, it's a.
I understand.
So in that sense, the professionals in Puerto Rico, that's the point that I'm trying to address, are basically leaving the island not only because of economic reasons, but of because of the society problems that we have over there. Getting back to the question of the shortage in Puerto Rico, we have a shortage of physicians, we have a shortage of registered nurses, and the problem, and the other, in terms of physicians, what's happening in Puerto Rico is that the Puerto Rican physicians who get trained come to the island, and the physicians that are basically now being in Puerto Rico are primarily foreign trained doctors from other countries who basically are moving to Puerto Rico. But almost like 70% of the patients that are giving care on La Reforma, which is at the Medicaid equivalent in Puerto Rico, are basically foreign-born, non-Puerto Ricans, let me put it that way. So in that sense, we have a gigantic challenge. The other challenge that we have is in terms of, for example, in terms of physicians, there is not an equivalent to what happens in the United States, where it's built into the reimbursement system or something called the graduate medical education, where basically there's no support for teaching of professionals in the medical field in Puerto Rico. And I believe until we do something like that, the exodus of professionals, not only in healthcare, but in many other professions, are going to be out of Puerto Rico because of the economic crisis, because of the the problems of our society. So in that sense, I think that those are big problems.
One last question.
What is the what is the proportion, do you think, of the jobs in the healthcare industry that you've done a chart before that are going to persons with immigrant H-1 visas or other type of visas, and you think that's likely to change or increase as coverage increases?
Well, one of the issues, and I spoke a lot to a woman by the name of Kate Tulenko, she's an MD, and she basically came to our organization to recruit us to try to, which is consistent with what you were talking about, which is how can we help erode what the United States is doing, which is draining the world of their healthcare professionals. And she basically told me, for example, in the city of Chicago, there are more doctors born from Ethiopia than there are in Ethiopia. There are more doctors from Ethiopia in Chicago than they are in Ethiopia. And she basically went down and she is a member of the World Bank. And basically they have a subgroup that deals with healthcare. And basically, the pitch that they were making is, you know, we have the contradiction that right now in the United States we have 10% unemployment, right? And then on the other hand, we have this dramatic shortage of healthcare careers, particularly in MD, primary care physicians, registered nurses, all of these professions. You have people who are unemployed, and then on the other hand, you have people who we have needs for this job. So the only thing that we have to do is train those people for those jobs, and we solve the problem.
Easy.
As opposed to basically go to have, for example,
Not that easy.
well, but that's it. I know that it's not that easy, but it should be easy. And if we do not try to deal with that issue, we should demand that we solve this
But we
problem.
get students at the community colleges that can't read or write and get them out of developmental and basic skills. It's a challenge, and we lose like 70% of Latinos in their first year.
Right, I understand, and like, and getting back to the point that I made before, where in our training program, it's not intended to get into basically one of the problems that we faced was you get somebody who basically had been out of school for 20 years, and then all of a sudden they go back to school. They do a lot of mentoring and a lot of tutoring and a lot of
high school graduates coming in and not read or write.
I understand, but I think we need to do the same thing. We need to prepare them for. We need to solve that problem. That's the objective. But the point that I was making was that we need to solve that. If we know what are going to be the American jobs. We cannot. The world is already telling us, please don't take our professional people. Those countries have invested in the training of people, of developing them, and then the United States go and take them. It's the same thing that we're doing in Puerto Rico. You know, and the difference in Puerto Rico, you don't need a visa. What you just need is to get the ticket and come in American Airlines, and you're in New York or whatever, you know, Orlando or Philly or Boston or Chicago, and you know, and you land a job.
The good thing is we have a panel that at the end, so stick around.
That'll be good.
Yeah.
So you have family members in Puerto Rico that die of cancer because they didn't get the proper treatment, like I did, or a 5-month-old baby that died because she didn't get the treatment she needed. You're concerned.
We are going to address many issues as the day moves on, but before we do that, on behalf of our staff, we'll think about things that I often don't think about. We want to give Dennis a little token of appreciation here, so he at least knows that we remember him.
Prisma llegó pronto. Gracias.
Thank you very much. I'm going to react a little bit. Pardon the public announcement here, but a few weeks back, Centro sponsored a conference on teaching Puerto Rican kids history and historical preservation for our youth. And we believe collectively, the people who put that together, that the sense of community and pride in their heritage is very important to motivate students. So this piece, the conference today, is just part of a comprehensive effort to rethink the way we strengthen the educational pipeline. And as you're going to see in the second panel, when we get there, we have a lot of case studies of industry, including health, in which we try to replicate a little bit of the success that 1199 has shown. And it's a challenge, and we understand that. We have, Centro has now created a unit, and we received support to start thinking about strengthening the educational pipeline. And we have a couple of approaches. I'm not going to go too much into that. One, which is for people who are transitioning from high school and then get to college, a leadership component that will provide the social and individual skills to succeed in college. As Danny said, we have too many people coming and not finishing, and we want to strengthen that. And so we're working on that. And on the graduate level, all this challenge about training and about providing services to our community require that our professionals have cultural competence, and they understand why it's important to understand the differences of the Puerto Rican community compared to others. This is not to say that we don't encourage comparative analysis of other Latino populations, but there's a specificity, whether you talk about asthma or you talk about motivation to become a registered nurse, that needs attention, and it's our intent to do that. So next semester we're going to have a conference in which we're going to examine cultural competence in the 4 same fields that we're looking at today, okay? In social work, education, in urban planning and community development, and missing one. And in public health. Go figure. And right after that conference in May, we are organizing yet another conference on policy. So we have to think about this comprehensively, and I really thank you, Dennis, for making the links between the educational system and the motivation of the kids, the thinking about the pedagogies that we employ, and try to bring all these things together to make a difference in our communities. So with that in mind, let me just to tell you a little bit of the synergies. We have today the presence of Ms. Santiago Taveras, who is Taveras, I'm sorry. Taveras. Your handwriting is confusing. Anyway, Ms. Taveras is the Deputy Chancellor for Teaching and Learning of the New York City Department of Education. And hopefully we have many future conversations in regard to this educational pipeline, how we strengthen it, and the cooperation between the high schools, the CUNY in particular, and other community partners that can make this happen.
We were also fortunate that in our data set there was data on spending by the school districts, and one of the things that we found is that they had data on how many of their teachers were certified, and also how much experience they had, and also how much money was spent in the actual classroom. We have a teacher-student ratio variable in the data set, and we assume that these kinds of expenses and these kinds of teacher quality indicators will have an independent effect on going into college. And by the way, some of these factors we're assuming that they're both significant for getting into college or getting into better jobs. The one factor that we take from what we call the collective efficacy literature is the neighborhood quality. And how do you measure neighborhood quality, and that we do that by looking at the percent of your neighbors who are what we call high status. And the argument here is that the more professionals and more middle class neighbors that you have, the more likely it is that a normative expectation and a sort of mentoring of youth in a neighborhood takes place. The assumption that this value of going to college, this value that going to college is going to pay off, is more prevalent in neighborhoods where you have these kinds of neighbors. Of course, the same way we have an indicator for affluent neighbors, we also have what we call concentrated poverty. And here the argument is sort of like the mirror image of the first one, that is, in areas where you have a lot of single-headed families, where you have a high degree of poverty, this is going to have negative impact on both educational outcomes and labor market outcomes. The collective efficacy literature tries to make the argument that there are behaviors that are more condoned, more acceptable in some of these what we call concentrated poor neighborhoods, and indeed, as you will see from the presentation of my colleague, you'll see that it did take an impact on these outcomes. The other one is we have data on how many hours were you working when you were a high school student. And here it's funny because on the one hand, we say that working too many hours has a negative impact on going to college. You know, the whole issue that you're overcommitted, you're trying to do too many things, go to school, but also try to work too many hours. And of course, many of our youth are pressured by their families to earn some money to help support the household. On the other hand, a lot of the labor economist literature suggests that experience in high school has a positive impact on labor outcomes when you're fresh out of high school. So on the one hand, we say it's positive for college going. It's negative for college going. On the other hand, we say it's positive for getting a good job if you don't go to college. So with this, I'm going to turn it over to my colleague Pat, and he will present to you the findings.
Let's see. This is the education longitudinal study. These were people who were in 2002 were 10th graders. One of the outcome variables we looked at was how far, the highest level of school you attempted by when you were age 20. Now we know the dropout rates are a lot. The percentage of Puerto Ricans that haven't finished high school over the years has been quite high. For Puerto Ricans who are of this age group, less than only about 7% of them by age 20 had not earned a GED or equivalent. It's go here. Where's the one though? This one. There you go. So yeah, just keep going. Keep going. One more. Here you go. Okay. So less than 10% have not finished high school by age 20, GED or equivalent, less than 10%. Still more than whites. High school diploma, there's about a 10% gap between Puerto Ricans and whites. Puerto Ricans are overrepresented among two-year colleges, but there's a big gap in enrollment in four-year colleges between Puerto Ricans and whites. So Puerto Ricans are overrepresented at all levels of attainment until you get to the highest one for 20-year-olds. Can you go to the next slide? So of these young people, there's 45% at 20 years old are in college. as opposed to about 65% of whites are in college when they're 20 years old. If you're not in college, you can be either poor or not poor, and about equal numbers of whites and Puerto Ricans are not poor. They're about 15%, but Puerto Ricans who are not in college are much more likely to be poor than whites. So the gap there is about 20%, and about equal numbers of Puerto Ricans are poor and in college when they're 20 years old. Next slide. Okay, so if you try to predict who's at a higher level of attainment when they're 20 years old, people who achieved more in high school are much more likely to attain higher levels when they're 20 years old. I mean, there's a huge effect of how well you did in school on how far you've gone by the time you're 20. Also, if you're from a high SES background, if you're from a concentrated poverty neighborhood, it hurts you. A concentrated affluent neighborhood, it helps you. So these are both neighbors and schoolmates, those measures of affluence and poverty. Kids from schools that have more students per teacher are hurt in the long run if you worked more hours during high school. Now, once you control for all of these factors, the differences between Puerto Ricans and whites disappears. So all of these factors can account for differences. If you look at just Puerto Ricans, and that's what predicts who's doing well there, high achieving Puerto Rican high school students are doing better. High SES kids are doing better. Kids from affluent areas are doing better. And strangely enough, if you're going to a school that is focused more on college preparation than general education, you're actually doing a little worse. So that one's backwards for Puerto Ricans. Next slide. So this is that other variable. So this is predicting whether or not you're in college compared to whether or not you're not in college and poor. High achieving students are more likely to be in college than poor. High SES students. Concentrated poverty hurts. Concentrated affluence helps. People from medium-sized and small towns are relative to the suburbs are more likely to be in college than poor. If you look at just Puerto Ricans, high achieving Puerto Ricans do better, and Puerto Ricans from more affluent areas do better with more affluent neighbors and classmates. Okay, how about the difference between being not poor relative to being poor? High SES increases your chances of being poor. Females have much higher poverty rates than males. This is just among 20-year-olds not going to college, remember. Concentrated poverty keeps people poor. The more hours you work during high school has a really strong effect on keeping people out of poverty if they don't go to college. And that's the only factor that predicts Puerto Ricans not being poor if they worked a lot of hours during high school. Okay, one more slide. Okay, so there are large gaps in education between whites and Puerto Ricans by age 20, primarily in the area of enrollment in four-year institutions. Now, for this young cohort of people, education levels are a lot higher than they were for older cohorts of people, but you still have these large gaps between whites and Puerto Ricans. It's just changed the place that it's occurring. Puerto Ricans from affluent families who are high achieving and from concentrated affluent areas are doing better in attainment. This thing about if they go to a school that emphasizes college preparation, they're doing worse. What we think is going on there is there's probably tracking in those schools. And so although they're attending schools with more of an emphasis on college preparation, they may be within tracks that are not emphasizing college preparation. So that's like within school segregation. And the other one is Puerto Ricans are much more likely to be poor by age 20 than whites. And the one factor related to Puerto Ricans not being poor is working during high school. So work experience, either you're getting some human capital or else you're getting more attachments in the labor force, more context there. So those are the main findings we have. Thank you.
last speaker is going to be Ramon Borges Mendez, and he's going to talk about stateside Puerto Ricans and the workforce development system.
Oh, that one? Yeah. Can I just?
Yeah, the next page, and then if you want to use the laser,
Back.
the laser, it's
Right here.
okay.
Well, thank you very much to Edwin Melendez, Centro de Estudios Puerto Ricanos, and all the other staff who put together this presentation. I should warn you. Anything you write about New York City is preliminary. That should be a line always in any kind of writing about New York City. I'm going to focus on New York City, but there are two other areas which are part of the study, but they're not enough. As Gary Becker says, statistics, after some time of torturing them, they eventually confess. So the data haven't yet been, really well massaged for two other areas, which in addition to New York City, I am including in this study, which are two of them in Massachusetts, which are Springfield, Holyoke, and Lawrence, Massachusetts, and in New Jersey, also Camden. Also very important areas of high Puerto Rican poverty concentrations. It's not. Oh, yeah. These are the cases which will be considered in the study, and right now I will only focus on New York City and the Bronx. I selected the cases based upon two important factors, I think, affecting the access of Puerto Ricans to the WIA system and to the government services. By the way, I'm not going to review the changes of WIA. That is a longer and different conversation, so I'm going to take for granted that at least there's some familiarity with it, but we can talk about it. Number one is the evolution. We went from maximum physical participation to third-party governance and performance management. That has dramatically affected the thrust of the process of incorporating community-based organizations into the policy-making process. And number two is the regionalization of Puerto Rican settlements throughout the Northeast and to Central Florida to small and mid-sized cities. I'm not so convinced it is a process of suburbanization because some of these cities and towns are not really suburbs. We really are mischaracterizing anything or any kind of special unit that is next to a city. We call it a suburb. That's not the case. Methodology, we use qualitative interviews with people from the Workforce Investment Board, the One-Stop Career Center systems, the Employment and Training Administrators at the federal level, CBO providers. We also carried site visits to the One-Stop Career Center systems. In New York City, we went to the Bronx, specifically to Hunts Point, which is the newest One-Stop Career Center system of the system. And we went to the 1 and 25th Career Center in Harlem. We also use official documents and other literature. This what shows in red is, unfortunately we can see it, but this is the concentration of Puerto Rican populations and the number of Hispanics that are served by WIA as of 2006 in each of those areas. It is impossible to disaggregate by Latino group. So we essentially paired them and compared them to the Puerto Rican population, and we kind of assume that if there is a high serving percentage of Hispanics in that area, we assume that it's at least catching some of the Puerto Ricans in the systems. As you could see, the number of Puerto Ricans in areas beyond New York City has been growing very fast and in places we never would have imagined, especially in Florida and away from New York City, which is the point about the regionalization of settlement patterns. Our cases are Holyoke, Massachusetts, Camden, Bronx, Springfield, and Lawrence, Mass. Holyoke and Springfield, for those of you who don't know, are very close to each other. It's about 10 minutes from each other. This is just more of the selection of the cases with respect to the total Latino population, total Puerto Rican population, in order to justify the kind of triangulation that we made with respect where to choose. In a way, also, and there's a little bit of convenience to this. I have been studying Lawrence and Holyoke, Massachusetts for some 20 years, so I know the city very well. I know there are high concentrations of Puerto Ricans in them, and I know their infrastructure, and I've been able to observe it for a long time. The workforce development approaches. This is a very important element in order to understand the adaptations of each system, or the way in which each system absorbs the client-based population of a particular workforce development system. Out there we can see 5 approaches. Work first, sectorial clusters, regional approaches, work supports and anti-poverty strategies, career ladders, and dual customer approaches. These are approaches in workforce development. I'm not going to go into the definition of each, but they're mix and match depending on where you go around in the nation. What characterizes them in a way is the time and complexity it takes to deploy each of those programs. On the short term, work first is the most simple in terms of in programmatic intervention, and long-term sectorial clusters and career ladders are the more complex and take the longer to deploy. New York City and WIA. Giuliani, between 94 and 2001, left a system in absolute disarray, in complete non-compliance with the federal regulations of the Workforce Investment Act. And actually, by the end of his administration, he was standing to lose the federal appropriation for WIA money. It only had established one career center system for the entire city of New York in Queens, and the programs was haphazardly managed by the Department of Employment and Human Resources Administration. They were kind of unclear actually how much money each would split, and it was transferred between both of them throughout the period of time that he served as mayor. Bloomberg came in and wiped out the department. He tried for about a year to rehab Department of Employment, but he ended up scrapping the entire agency in order to bring to compliance the system, and gave the adult WIA stream to the Small Business Services office, and in there he created an Office of Workforce Development, and then he gave the youth WIA money to the Department of Youth and Community Development, and then proceeded to create one-stop career centers in every borough, plus he has been developing 2 sectorial one-stop career centers, one in health, which is located at LaGuardia Community College, and the other one based on transportation that is located in Queens. There are 2 more community career centers which are presumably slated to open. One in manufacturing, which hasn't opened, and one in Hunts Point, which was very interesting. It was supposed to be a career center developed around the Hunts Point market, which is the world's largest distribution for fish produce and meat, and serves about 30 million people in terms of distribution. And when it's also important to understand that the career centers are managed by all different vendors, because it's a bidding process that is put out by the city. So VIP Services, which is the one that manages Hunts Point, was given the charge to develop a partnership with the actors at Hunts Point. And when I visited Hunts Point, they went there and they were told to essentially take a hike. Don't even show your face around here. The Hunts Point is a very tough market. It is controlled heavily by unions, Teamsters, and other unions. So going there and showing off that would you please give me your list of jobs, it was not very well received. So essentially, Bloomberg brings it to compliance with federal law. In terms of allocations, the system has been in decline from 116 million to 65 million, a reduction of 33% in adult, 31% in youth, and 57% in dislocated. In 2008, the WIA allocation was, which was about 65 million. That was the breakdown. And as of 2009, this year, the Revitalization Act of the Obama administration doubled the budget of the WIA allocation. This is the WIA system as it looks like now. The New York City WIB, Small Business Services that controls the WIA Adult Services, the Department of Youth and Community Development that controls the WIA Youth Services stream. This is the community, that is a Center for Economic Opportunity, which is a new agency created by Bloomberg in order to deploy its anti-poverty strategies, which also pitches into the kinds of programs that are created at the level of the workforce development systems. And these are all the vendors that control and that manage each of the one-stop community centers. With respect to community-based organization outreach, what we can see is just simply a referral program that connects to CBOs as very common referral agents. Now, there's a whole bunch of literature out there and newspaper articles about Bloomberg, innovative policies in workforce development. I have been observing these workforce development systems for a few years already, and we've done some writing with Ellen. Bloomberg, the only thing it's done is just bring it to federal compliance. If you examine the nature of those programs that are in place, are all simply workforce programs, which in the context of the recession perhaps is the only thing you can do, but there isn't anything much more creative on the table as far as workforce development programs. So what is the situation of WIA in Puerto Rican neighborhood? First, CBOs are placed in a peripheral fashion in the one-stop career center system, essentially as referral agents through the only program that effectively connects them, that is the CBO outreach program. I have to say, in all justice, that the Department of Youth and Community Development has a very different infrastructure to SBS, and really has a much deeper penetration in terms of the community-based organization it uses to deploy its youth services, which requires a very different discussion, and that process is not attributed to the Bloomberg administration. Second, it consolidates the position of CBOs in in a sort of a downward specialized fashion that weakens them. Simply being treated as referral agencies. There's no training place in most of the Puerto Rican CBOs. The WIA system is also only accepting job-ready people for workforce placements. All the workers that do not come job-ready to the one-stop career centers are sent back through this same referral system. Who knows to do what? Essentially to receive more services in the eventuality that they may be able to get a high school diploma, get language skills, and come back into the one-stop career center system. Finally, two other important aspects. The performance-based managerial style is blocking CBO participation. There's a big conflict between mission-driven CBOs and performance management systems, and it hasn't been solved. And that's a longer discussion. And finally, the WIA system is not engaging with organized constituencies. You interview the people at the WIB, especially the leadership of the administration at the WIB, and they'll tell you, we only see clients. We don't see ethnicities, we don't see unions. As a matter of fact, unions are a little difficult, so we avoid them except when we have to deal with them, as CIU in the context of the sectorial training group, training one-stop. In terms of policy, what does that mean? We need to refurbish Puerto Rican CBOs to change positioning in the WIA system and other social delivery systems. Second, we need to connect the WIB through the channels such as unions and CUNY. Unions, CUNY, and there are some very important agents that have presence in the WIB. But I don't think that connectedness is having its effect or is translated into policy formulations to connect better to that CBO infrastructure and to those neighborhoods. Finally, to connect the community colleges and the sectorial one-stop career centers to the CBOs that remain there in the field, And finally, pressure for moving the system beyond work first into much more complex strategies that have to do with career ladders, sectorial development, and sort of the stuff that Denny was speaking about this morning. Thank you very much.
I thought we were going to have a discussion now?
Yes. Yeah.
Okay.
Let's make it short, but yeah. I have a question.
Yeah. Oh, questions you want to take? All right.
Questions before discussion?
Yeah, that's what I... Yeah, okay, fine. Now we're going to have our discussants going to be Luis Falcon and Cordelia Reimers. I guess maybe we can get some chairs up. I'm not sure how we should...
Just come up.
Yeah.
I'm not sure which order we should do. Because what we did... what we did, Luis... Huh? Oh, I'm Cordelia Reimers, and what Luis and I did was to divide up the two of the papers between us, and then the first paper, Ann and Edwin's paper, we were both going to make a few remarks about. This was because of the order in which we got the papers. So I guess I'll start off, but I will start with the second paper you heard, because that's the one that I'm totally responsible for. Now, do you have my, it would be probably the top one. Yeah. No, the next one. The next one. Both of them begin with B. Okay. Yeah, that one. Yes, the transitions paper. And go to the next slide. I found some very interesting results. Being Puerto Rican doesn't matter, apart from its effect on the other variables where it is no doubt very important. So it's, you know, once you've adjusted for the SES of the family, the neighborhood the person comes from, the type of school, there's no more ethnic difference with Puerto Ricans from whites. And then, interestingly, school characteristics are relatively quite unimportant. In the pooled sample, you have only the student-teacher ratio mattering. When you look just at Puerto Ricans, also the college prep, with that puzzling result that college prep school hurts chances for Puerto Ricans to go to college. And the significant variables are all about the neighborhood income, the family's class background, the student's own achievement and their hours worked, and the city size. Now, I'll take a few of these in turn. The hours worked, more hours hurt educational attainment, hours worked in high school, but help with not being poor if you don't go to college. So I'm wondering, could there be some reverse causation here? Could kids who don't aim at college then work more in high school? And they get more experience, more connections to the job market. Next slide. Interestingly, foreign background is not important. That was a bit of a surprise, and one thing you might do to probe it further is to unpack the index and look at a set of dummies for a generation on the mainland, and if, I don't know whether age at arrival is in the data, but if it is, it would be good to even add an extra generation so you can see just what's going on with the foreign background variable. And interestingly, city size, we found that being from a medium-sized city or a town hurt chances, but since Puerto Ricans are as likely to live in suburbs as whites and much more likely to live in big cities, and big cities have less of a negative effect on college than towns and medium-sized cities. In a way, being in big cities should be relatively helping Puerto Ricans more than it helps whites to go to college. I'm very puzzled by the college prep high school effect being negative. I understand the idea of tracking, but that still leaves the question of why should, if Puerto Rican students are in the non-college track, why should that be worse than being in a general high school that doesn't have a college prep orientation? So I'm wondering if there is information on the courses students were taking so you can verify more about what's going on in those schools. Next slide. So some suggestions. One is to just show some more comparison groups so we get a sense of the context that we're looking at Puerto Ricans in, particularly to include other Latino groups such as Dominicans, Mexicans, and also African Americans, so we just get a richer picture. And then the variables are mostly included as indices, and it's kind of hard to interpret those results. So it needs to be explained better in the paper what the loading of each factor in the index turned out to be, so we have a sense of what it's picking up mainly. And in some cases, unpack the index and use dummy variables to see the separate effects. Also, in the table, it would be very useful if the coefficients were translated into the effect on the odds ratio. I didn't mean log odds there, on the odds ratio, because that's a little more intuitive than log odds. Next slide. And then the three-way logit for going to college versus not being poor if you don't, and not going to college, both against being poor and not going to college. It's a little hard to interpret that because some of these results, higher SES increases the odds of going to college but lowers the odds of not being poor if you're not in college, and concentrated affluent neighborhood increases the odds of going to college but has no significant effect on not being poor and not going to college. It's a little puzzling that those are coming out that way. So I'm wondering whether the model should rather be a two-stage logit, where you first look at going to college or not going to college, and then conditional on not going to college, look at not being poor versus being poor. Because what the three-way is doing is basically assuming the odds between not being poor and being poor are the same, whether or not you're including going to college as a possibility. And also it assumes the odds between being in college and not in college and poor are the same, whether or not there's the possibility of not being poor if you don't go to college. And so that's a little hard to get one's mind around. I think that's it for that paper. And could we get the other slide and talk about the Velez and Goldsmith paper? No, the Visser and Melendez paper. That's the, you got it? Okay, I will, next slide. I won't spend much time on the first slide. This conceptual debate about whether we want to look at the worker or the job when we're thinking about low-wage jobs. This is kind of a economics versus sociology debate, and it turns on issues of how mobile do you think workers are between industry and occupation, and how important is education, things that people get outside the workforce versus what happens to them in their job, whether they get trapped or whether they are more able to move as their skills permit. And so I don't want to spend too much time on this because we're very short of time. So next slide. There were very good ideas in this paper. The summary of the different ways of defining low-wage persons was quite clear and interesting, and the critique that these did not take account of the cost of living in the area when you do a national percentage low wage was an excellent idea. So they take the definition that a person is low wage if they are below 2/3 of the median wage. And I wasn't sure whether you were using the male wage or not, but I gather not. So I think that's better. And adjusting for the MSA wage distribution is an excellent idea. So interesting results. The median wage, I guess that's annual earnings for individuals in 2007 is barely above the poverty line for a family of 4. So no wonder we see so many 2-earner families if there is a second adult there, and no wonder we see so many single-headed families in poverty, in low wage and poverty, because they can't earn enough to get out. The extraordinarily high percentages of youth and even of adults in all ethnic groups who are low wage is quite striking, and it really tells you something about what's been happening to the U.S. wage distribution in recent years. Now, whether there is progress across cohorts, I thought I was seeing possibilities that there might be for Puerto Ricans when you look at the youth compared to whites versus the adult Puerto Ricans compared to adult whites, because the gaps in the percent low wage are smaller for youths than for adults. It could be a cohort effect, or it could be that the age earnings profile is flatter for Puerto Ricans than it is for whites. Not that things are going to be better in the future as this generation grows up. There is no gap if you take speaking English well or only English together. There is no gap in youth between Puerto Ricans and whites, which is, again, possibly a sign of progress for the future. But the gap in the percent with at least some college is larger for youth than for adults. Suggests that Puerto Ricans are falling further behind. Or could it be that more Puerto Ricans are going to college beyond age 20? Certainly my experience at CUNY is that I have a lot of students who are older than 20, so it's not clear what that means. Next slide. So I had just a few suggestions for further research. Looking into why Puerto Ricans are more likely to be in service, sales, and office occupations than other low-wage Hispanics, I think we have a pretty good hypothesis that because they're urban, more urban than others, that they're better educated actually than other Hispanic groups, apart from Cubans. Or could it be also more Puerto Ricans are the 3rd or higher generation on the mainland now than in other Hispanic groups? So it would be good to compare with the other groups after adjusting for the key characteristics. And also to compare the percent of low-wage Puerto Ricans in these occupations with the percent of all workers, because those are large occupational sectors. It would just give us a better sense of how much disproportionately are Puerto Ricans represented. And I like to see if it's possible comparisons with Dominicans, particularly because they tend to live in the same general areas as Puerto Ricans, and so that gives a good context control. And then finally, some of the numbers in the tables seem to be incredibly volatile from year to year, so I'm wondering how large those cells are and whether that sampling variability. So if you showed confidence intervals for it, we'd have a better sense of what may be going on. Thank you.
Yeah, Luis was going to comment on Ramon's paper and some may be possible.
Luis going to come? Come here.
Good morning.
Good morning.
Delighted to be here. It's been probably several years since I've been in New York City. And given that I was probably the only person that got up at 4 in the morning to be here, I'm going to take, what do I have, an hour? My task was to go over Ramon Borges's paper, and then Cordelia and I had split Edwin Melendez's paper. I was able to spend more time on Ramon's paper, so I have a longer set of comments on his work, and less on time on Edwin's because it arrived on Wednesday. But I got something there, and I think Cordelia did an excellent job. So I always, she went first. I think I support all her comments. Ramon, I'm going to be a little harsher on him because he's a little less sensitive than Edwin. So I think that what is the task that Ramon sets out for himself in this paper is to look at how workforce development systems have changed, how do they differ, how do they respond to the needs of Puerto Rican low-wage workers. And let me say that up front that this is a very interesting project. I think the idea of the 3 sites, I think the idea of taking into consideration the level of political development in the community, the amount of activism, how that interplays with resources, with infrastructure in the area, with political power, with the ability to influence the delivery of services, how the services are targeted. I think this is all very critical and very relevant to the question that he has at hand. The paper is very well grounded in the most recent literature. It's empirically based, and for a change, it's qualitative, which I like. Since there are lots of quantitative pieces out there on labor force development and low-wage workers, but there are not that many qualitative pieces that have gone out and asked serious questions of people who are involved in the day-to-day delivery. So all those things I like about the paper. Now, what are the challenges that Ramon is facing in putting this paper forward? And I think my job here is not as much to question the foundations of what he's trying to do, but try to see how I think the paper can be strengthened, particularly, and that's my first caveat, because the paper is not really fully developed. He still has not analyzed the data from 2 of the sites. In fact, he pulled a fast one on me. That policy slide that he had on the presentation was not in the paper. So what I see this paper is I see a tension in the paper. A tension between being what is essentially a research report and what is an academic journal. And I think that it is a tension that has to be resolved. What is the target audience? Where is this paper going to be delivered, in a sense? Is it reaching out to, in terms of development of research? Is it a combination of policy and practice, meaning it has to be more friendly to an audience of practitioners? Or is it both? And I think there's a tension in the writing that is very visible, and I think that he needs to address. There's a very strong grounding on the theoretical aspects of the literature, and I mean really strong, since Ramon has been working in this area for a very long time. There is less emphasis in the paper, at least in the piece that I read, on the methods of the research process itself. In other words, how did he go about framing the research, the kind of questions that motivated his intentions, the selection of the 3 sites, since he's doing qualitative work, an analytical framework for the type of questions that were going to be addressed to the people that he was going to be talking to, that is lacking in the work. And I think it's essential that those be presented, because it's, in particular for qualitative work, it allows for a cleaner interpretation of the discussions, of the presentation of the textual data, and so on. There's not a clear formulation of the research questions. What are the hypotheses that are driving the research? He tells us that he wants to understand how programs that are addressed to low-wage workers are interfacing with the needs of Puerto Ricans in those areas. But I would like him to be a little more specific about the questions. What are the key variables that are at play in this analysis? As it stands, the paper is written for an audience that is very thorough in the literature. It is not for practitioners. And I think that he can take the next step, perhaps with another writing from that work that is more aimed to practitioners, because I think this is going to turn out to be a very rich project. there's a lack of conceptual definitions, and again, this goes back to the question of defining the research questions. Ramon throws terms around, and it's particularly hard to follow, closer to midnight. When you're reading the paper and you see about actors and networks and labor market intermediaries and institutional infrastructure, and I had to look up this economies of scale in Wikipedia because I couldn't even remember what that was. But it's all the language of the literature. It's not that he's being particular uppity about it. It's just the language.
We live in the same town, so I catch up with him.
It's the language. Actually, we break bread regularly, so I can take liberties here. So, but I would like him to have more conceptual definition of what all these things mean, because it allows for the reader to understand what the concept is, how it's been operationalized, and how he's measuring it in his work. And I think it's important to understand the reader. So I would encourage a little more definitional clarity in the presentation. This section is from the research methods section in the paper, and again, he's telling us what he's doing, but he's not telling us why he's doing it, and I think it's very important. The paper, as it stands, it focuses on New York, is very thorough, gives a very nice overview, as he showed in the presentation, of the Giuliani years and the years that follow, very strong historical background. And of course, since it is a work in progress, it doesn't go any further than that because, again, he's still looking at data from the other sites. So at this point, what I would like him to do, what I would suggest, he can do whatever he wants, but what I would like him to do is to focus more on definitions. What are the elements and how do we recognize? How do we recognize what an infrastructure is and what characterizes it in these communities? How do we measure community activism? How do we know that this community is not fully developed to really be a strong partner to the delivery of services? How do we know which communities are strongly organized and which ones are not? I would like him to flesh out a little more of the interviews. What are the drivers? What's driving the discussion? Generally, in qualitative studies, you don't have a full-blown questionnaire, but you have a set of guiding questions that you're sort of administered to everyone, and then you allow the discussion to flow and you follow it. So I assure that he has that. I would like to see that in the paper. So people stand, they sort of understand what was the common ground that everything evolved from. And I would also like him to think about developing some strong typologies about community activism as he continues collecting data and making comparisons to try to understand in a more visual way how these communities differ and to try to bring some more specificity to this field than it currently has by taking these concepts and really articulating in a way that makes sense and that help to illustrate his findings. I think he's onto some very strong it's a very strong and important piece of work, and I really enjoy reading the paper, and I think we're going to see a lot of good things coming out of this research project. Okay, Melendez and Visser, and again, I'm going to be a little brief on this paper, particularly because Edwin still has to reimburse my airfare. But I agree with Cordelia. The paper is very well written. It's well grounded in labor market literature. It tackles a number of definitional issues. There's a section that has a very nice back and forth on the definition of low-wage workers, and they take the critiques out of the literature. They give their own perspective on it. I think it's a very well articulated section of the paper. At the end of the day, I believe you settle for a definition of low wage that is relative to the wages for males in the area, right? At least that's what I saw in the paper. And of course, I raised the issue when you measure women at the level of men, what are the consequences of doing that? Particularly as you think about family dynamics, the likelihood to be in a relationship, the likelihood to be married or not, to have young children, to lead a household or not. I think it's important to take those into consideration as you look at the consequences of defining low wage for women, looking at the salaries of men. There are also consequences of ignoring structural characteristics such as the cost of living. Cordelia addressed these issues, and the authors are fully aware of them, and they do discuss them in the paper. They do address them. They're not ignoring them, but I think it's something to think about a little further as they work their way through it. The results from this piece are pretty sobering. You know, to think that 80% of all the 18 to 25-year-olds are in low-wage jobs, 50% of those 26 and older are in low-wage jobs, that, you know, 3 sectors account pretty much for the vast majority of the low-wage workers. Over time, at least in the way that I read the tables, the percent Puerto Ricans in those jobs is getting higher. So one question that I had is this a consequences of the economic deterioration that was ongoing, or is just the people that, you know, the sector employed in those, it's really, I mean, it's not just a structural change, it's really the impact of individual characteristics flowing into those jobs. I think it would be important to disentangle that. The pattern for the other groups, I mean, some of the tables are comparing to other Hispanics, but the rest are comparing to everyone. I think it would be nice to unbundle those. I think the comparisons to non-whites will be very useful to try to understand what is happening in the low-wage sector. There's some confounding of geographic area and also of ethnicity because of the aggregation of the data. Cordelia talked about some of that already, so I won't go into more detail. Overall, I thought that it's a well-written paper and it has a lot of potential. I think that it would be useful to provide a little more background in terms of how did we land in this particular context we find ourselves today. Meaning, what has happened in the last 20, 25 years in the labor market that has led to this concentration. I mean, this just didn't happen. It didn't used to. In fact, you do make that point about the decline of agriculture, manufacturing, and so forth. I think you should flesh it out a little more, provide some numbers of how this occupational distribution has changed over time, and bring them into the paper, and it will make an even stronger paper. So, thank you.
We're really running short on time, so what we'd like to do is just open it up for about 10 minutes worth of questions. So perhaps you can keep your questions short, and also to the presenters, keep your responses kind of short, because we really do have to wrap up and move forward. Okay, so are there any questions for any of this? Edwin?
I'm eager to ask a couple of questions. So the first one is to William and Platt, because in a nutshell, it seems that the policy recommendation that comes out of that paper is we need to reconcile work experience and college transition for people that go to college. Those two things are working in opposite directions. And I know it's a challenge. The question is, how do you tackle such a problem? I mean, obviously you have identified the problem, and you're both, grounded in this type of work. So I'm eager to know how it is that you reconcile the work experience to the transition to college in a way that they work in the same direction. And the second question for Ramon, I think I didn't hear you expand too much on the trends of the Puerto Rican CBOs that make those connections to the infrastructure of the WIA. And if I understand, my punchline everywhere I go is that the restructuring of social services in New York City has pretty much wiped out services across the board, not just employment, but health and so forth. And I'm wondering what did you find? And maybe Anne can talk a little bit, respond to Corky about why is it that we don't have a model that explains the operations for all those factors which we intended, I think.
Well, I guess my bias in terms of the work experience is that I rather see Puerto Ricans go to college than going to work right away. So I was happy to see that working a lot of hours has a negative effect on going to college, which probably suggests that there is a need that is not being met in those families that they have to send these kids to work. The second one, I mean, that's a tougher one. I mean, maybe there's a link between what you guys found in terms of the service sector, and it's got to be a way to see where they are working, to see why it has a positive impact, and I guess it's a matter of finding the right data set. I don't know if that was.
Yeah, I mean, the stronger implication is, or the stronger policy recommendation is to redistribute income, to end neighborhood segregation, and then school segregation, and then you have all the Puerto Ricans going to college anyway.
You're a socialist like Obama.
So, the work one's important. Maybe if we run the models the way that was suggested, the work one might be less of a dichotomy, might have less opposite implications. So let's just hold off on that. Oh, I don't know if the other people wanted to respond to Edwin's comments. Did you guys want to respond?
In terms of the specific questions, there are no Puerto Rican, or for that matter, that I could readily identify Latino organizations in the SBS food chain. That is, the one-stops are managed by private contractors that then use a network of community-based organizations in which there is presumably some contact with some Puerto Rican organizations in the Bronx, but it's very hard to find them. So with respect to the Department of Youth and Community Services, I went through a clean sweep of their entire web site that gives a list of all the subcontractors per area and program of service, and I could not find any readily available identifiable Puerto Rican organization. I could find a couple of Dominicans and a couple of large organizations where Puerto Ricans have been participating for a long time, but not per se Puerto Rican organizations. And it is the general talk that they have been put out of business by the general managerial restructuring that has gone on in some of the agencies at the level of the city. So that's kind of mentioned in the paper, but I'm being a little tenuous until I go further and talk to a few of the other agents, until I get more and have a much deeper research with the vendors that control the one-stop centers, and with a couple of the community colleges that are mentioned as part of the story of the redesigning of the workforce development system of the city of New York.
One more question, then we'll.
Yeah, about the Pfizer and Melendez. That I think maybe want to know whether these low wage are entry-level wages, and maybe to do that you can, instead of taking the 18 to 25, maybe you should follow the age to older age workers in 10-age group and see what happens across the when the worker ages. And the other thing is that when we put in Puerto Ricans, I think, well, we're not making differences between Puerto Ricans, born in Puerto Rico, Puerto Ricans here. And I think the policy implications are very different depending on what you find.
Absolutely, and I'm actually going to take the time to respond to Edwin's question and the critique of Cordelia. And that's actually the second part of this project, which is the estimation of the model, the probability of if these various characteristics, whether or not you're born on the island, whether or not you're a certain age group, whether or not you're a certain education level. We just wanted to make sure that empirically we were good on our definition of low-wage labor, and I should clarify, we compared it to earning less than 2/3 the median wage of all workers in a given metropolitan area, not by sex or gender. And even then we're still debating as to whether or not that's a kosher way to do it. Are we controlling enough? We will be able to control enough in the model when we control for characteristics like gender, race, and for Puerto Ricans more specifically born on the island, not born on the island, education level, etc.
So we're beginning the second panel to today's conference. It is called Community Responses. And I am happy to I'm pleased to say that this is an all Hunter College panel. We have colleagues from the different schools and departments of the college. We will follow that program, so we will have Carmen Mercado from the School of Education. We have from the Center for Puerto Rican Studies, Andres Torres and Carmen Vivian Rivera. And from the School of Social Work, our hosts, we have Anthony De Jesus. And from the Department of Africana and Puerto Rican and Latino Studies, Victor Torres. Again, all colleagues from Hunter College, the different departments and schools. We will begin with Carmen's presentation, strengthening and connecting pathways to teaching careers for Puerto Ricans and other Latinos from low-income households and communities. Again, we have 10 minutes to make presentations. After the presentation, we will have our two discussants, Lane McCormick, also from Hunter College, and Nestor Rios, affiliated with the Center for Puerto Rican Studies. Carmen.
Okay, consíguemelo. Good morning, buenos dias, or is it afternoon? Okay. First of all, understand, I come from the School of Education, and I feel like a fish out of water. Can you hear me?
Yes.
Yeah. Okay. I'm not used to talking about workforce development or working with a lot of statistical data. I work with qualitative data. And so it's been a wonderful reorienting to the realities that we need a lot of mixed studies, mixed method studies as opposed to one or the other. And so I'm happy to be here to share with you what I have been doing as part of the project called Strengthening and Connecting Pathways to Teaching Careers for Puerto Ricans and Other Latinos. Basically, the project has three proposed goals. One is to study the policy context as it shapes workforce, the teaching workforce in the United States. It has implications for how we can construct responses that are effective, and it also has implications for how we may proceed to push for policy that would be of greater benefit to the Puerto Rican community. The second goal of the project is to identify actual alternative teacher preparation programs that exist. Now, when I say alternative programs, technically speaking today, we talk about alternative programs that expedite the entry into teaching. And those programs, such as the New York City Teaching Fellows Program, which is the largest alternative teacher preparation or certification program in the nation, they can become teachers normally within a year if they come in with a GPA of typically 3.3 or higher, a high-ranking graduation from a high-ranking institution, and passing the requirements of the state, meaning that most states, not all, have a teacher examination that candidates need to pass. Typically, in the past, the traditional teacher education program, which is still the majority, is a program that takes at least 2 years. In both programs, the population of Latinos in general and Puerto Ricans in particular are underrepresented. I know from lived experience. I've been teaching at Hunter since 1977. I entered the Department of Curriculum and Teaching, where I was one of 2 Puerto Rican faculty members in 1988. Since 1988, my students have gone from being bilingual, getting ready to teach in bilingual programs, to primarily alternative students who are coming in through alternative pipelines into teaching. I do not work with I think you can count on the fingers of one hand how many Latino and Puerto Rican teacher candidates I work with. And so the issue is it hits home to me as somebody who's committed to, advancing the community agenda. And the third part has to do with the fact that I'm looking at programs, alternative programs that are directed at Latinos as well as other minorities. I have not found any that says exclusively Puerto Rican, because I think the days when Puerto Ricans were the exclusive focus of teacher preparation programs have long ended. If you did a historical analysis, you would know that in the 60s and 70s, we did have the majority of programs saying the preparation of teachers to work with Puerto Rican children. And in New York City, which is the largest home of Puerto Ricans, right? Up until recently. So the third goal of the project is really to see how we can connect the programs that exist so that they are sustained and strengthened, and also work towards moving let me see, I have to find the technical term for this. We know that the teacher labor markets are very local, but the needs are national. So how can we move local forces to respond to national needs is one of the issues of concern. And I'll share with you a little bit about that. Please know that my project just recently, this past month, got IRB approval, and much of the work that I have done has been based on a literature review of projects and a literature review of the policy context. I think that that really is a very important part of the paper, because I think the comments I heard earlier today had to do with the need for a historical context on the situation, and that doesn't come from doing the work other than through the reading of the literature and trying to find out where we have been and where we are now. You don't have the data in front of you. These are my objectives as stated in the proposal. I want to move quickly because with little time. I want to go immediately to the 8 projects that I have identified nationally for closer examination, because they yield some promise of working for developing a teacher workforce that is Puerto Rican and also other Latino groups. It's Appendix A. The programs I identified through a lit review and through my own professional networks, and I must tell you that I know at least 4 of these programs through lived experience. It's not, when you are in the field, you just don't rely on what the literature says. You have to combine that with your own background. The dates that you see there in front of the project are the dates when the project was initiated, which is important because all the projects are at least 5 years old. And actually the oldest project, which came as a surprise to me, is 30 years old. All right? The projects come from different places. I think this is probably one of the few ones, the Bronx Education Alliance, which probably many of you have heard about, is an extensive pipeline that actually begins in middle school. And so I want to explore more about their own success rate in preparing Latino teachers and Puerto Rican teachers in particular. The second program that is in Central Florida is a program that I literally just learned about through the literature. Of all the programs, this one I know the least. I could not find a program that even compared to it in terms of its emphasis on the preparation of minority teachers. All of the programs prepare minority teachers. The USC program is of interest because it's oh my God, 5 minutes. The USC program is of interest because it's a Ford Foundation project, and it turns out that the Ford Foundation and DeWitt Wallace Reader's Digest are the 2 foundations that are supporting pipeline programs for minority teachers. They're not coming from other federal interventions. They're coming primarily from foundations, which is a big change, at least from my experience. The New York City has the bilingual pupil service. When I started out at Hunter, most of those paraprofessionals who were being trained for bilingual settings were Puerto Rican. And they eventually became teachers, and some of the strongest teachers and principals actually in bilingual ed and in general came from that program. But that program doesn't exist anymore the way it did before. Now it's broadened to include other groups, language groups represented in New York City. And quite frankly, I need to get back into talking to the people who are in it now. So all I have is this historical perspective and more to come. The START Teacher program is the one that I'm fascinated by the most. All of these programs, as you can see, most of them are based at some institution of higher education. The START Teacher program is a program that was started by Haberman at the University of Wisconsin in Milwaukee. And what I am really taken by this program is the criteria that he uses or that he proposed to select teacher candidates is not your typical criteria that I shared with you earlier. It's like people who are committed to working in the community, people who have promise and interest, but who don't have the profile of the typical candidate that we now have in programs like the Teaching Fellows. It was a very successful program, according to the literature I've read, in terms of increasing the number of African American teachers. I do not know its impact on Puerto Rican or other Latinos, but I am interested in the program itself because it's such a stark contrast to the kinds of teacher preparation programs and entry requirements that we have today. The Grow Your Own is probably the only program that I have found that is literally community. It started in the community, and the community pressed for policy changes at the level of the state. And so it's a relatively new program. It started in 2003, although the roots of that program are older. And I found out about this program at ARA, and I am interested in this particular site visit because to me this represents more of the kind of approach that we need to take in terms of pushing for more Latino and Puerto Rican teachers. I'm just going to skip those. The rest of most of these in general are traditional teacher centered programs that are based at the university for teacher preparation. They're not expedited, although they do provide support in the classroom to a greater or lesser extent at the beginning to assure retention. Okay? I can't say very much more other than this is the range of programs that I'm interested in studying more closely to understand better the approach that they're using as opposed to just using the literature that exists online. Okay, I'm going to stop. Let me see. I have to say one more thing. I'm sorry. There is the National Latino Research Agenda Project that exists as a Centro project. I don't know how many of you have heard about it. Pedro Pedraza is the person who organized that project. And what that is I don't know if it's, no, it's okay, you don't have to listen, you can listen to me now. What that is, the Latino NELRAP for short, is a coalition, a grassroots coalition that brings together the community, the institutions of higher education, and other key players in education. And presently we have projects that are participating in this network in key parts of the United States. And so when I mentioned to you the third goal of the project is to connect these individual projects so that they are strengthened, we have an infrastructure in place through NELRAP. It's taken 10 years to build, to connect the projects. And so the third part of the project is really fleshing that idea out more, and that has to be fleshed out with the NELRAP group, which I'm going to speak to in next month. Okay, I think that's it. I've taken my time. Thank you very much.
Thank you, Carmen, particularly for sticking to the timetable. Our next panelists are Andres Torres from the Center for Puerto Rican Studies with Carmen Vivian Rivera, and their presentation is titled Pathways to Economic Opportunity in the Health Industry.
So passing out some background handouts, and Carmen Vivian doing the heavy lifting. Appreciate it. You're doing the heavy lifting.
No, I have no PowerPoint.
Okay.
You could just listen to me speak. The topic of our study is Pathways to Economic Opportunity in the Health Industry. And what I'm presenting this afternoon are preliminary findings from interviews that we've conducted to date. Our work continues to move on. As Carmen said, we also got our IRB approval late. This study looks at specific programs that provide training to low-wage workers in the health industry. The programs envision themselves as entry points for career ladders in this sector and generally include Puerto Ricans and Latinos in their target population. The study examines the role of entities such as unions, higher education institutions, community-based nonprofits in the design, management, and development of services targeting low-wage workers. This preliminary summary reports the results of 4 interviews: 2 union training and education programs, 1 home health care trainer provider, and 1 higher education institution's continuing education division. We focus on 3 areas in the present summary. First, on the demographic profile of the training program participants. Second, on program operations. And third, on challenges and recommendations. One thing I would like to note is that except for 1 case, interviewees were unable to provide information on program outcomes data such as placement and employment, wages at hire, and job retention. So let me move on to the preliminary findings. First, about participant demographics. In the 4 programs, the majority of participants are women over the age of 30. In 3 of the 4 programs, Latino participants comprise less than 25% of the total. In the continuing education program, approximately 70% of participants are Latinos. The 2 union-based programs and the home health care agency report that African Americans, Caribbean blacks, non-Hispanics make up over 50% of the participants. In the case of one of the unions, over 80% are African American. One union-based program reported some 25,000 members currently enrolled in their training programs. The other union-based program estimated 3,000 enrollees in their learning center, with approximately half of these being union members and the other half non-union community participants. Another 1,000 in this union-based program received scholarships and funding for tuition to attend local universities and colleges. The continuing education program increased their enrollment from almost 2,000 during the 1999-2000 school year to 9,540 in the 2008-2009 school year. They estimate that 80% of students enrolled in their Certificate for Nursing Assistance Program, the CNA program, passed the certification exam. Other background information is extremely variable depending on the program. Information on work experience, language, family composition, and welfare participation will be available in the final report. Now I'd like to move on to the program operations and looking at recruitment strategies, the collaborations that exist among within these different training programs, training courses, and social supports. All interviewees use a variety of trainee recruitment methods, including advertising in local newspapers, organization websites, mass mailings, leaflet distribution, and outreach to their partners in community-based organizations. In the case of the unions, their membership learns of career ladder opportunities via union meetings, newsletters, through their delegates, the Job Placement Center, and the union website. One interviewee explained how it took a great deal of strategizing and willingness to change their usual methods of recruitment when trying to reach disconnected youth. In this case, announcing their program on Craigslist proved to be the most successful, drawing a wide interest, and that was one of the union-based programs. All 4 programs engage in a wide variety of collaborations and partnerships. These collaborations help in making job referrals for training completers and in identifying potential career ladder opportunities within the industry. Collaborations mentioned include health industry partnerships, and that covers the spectrum of employers and service providers, not just the hospitals. Educational institutions, that would include colleges and universities, school districts, and specialized high schools. Government agencies, community-based organizations, the unions, and one-stop centers. Informants describe the range of training and courses they offer to participants in their training programs, and these normally include ESL, GED, citizenship process, academic preparation, life skills, and job readiness. Preparatory classes for college entrance exams
Licensing and certification exams are also offered, but we should note here that this represents the full range of courses offered among the 4 programs and not necessarily what is offered by each program. A common theme among the programs was the importance of social supports for participants. Child care services, mentoring and counseling, and financial assistance were deemed highly necessary. Let's look now at some of the challenges that the informants presented to us. First, all interviewees described similar factors that contribute to low-wage workers' inability to secure better than entry-level occupations in the health industry or to achieve upward mobility within the sector. The primary barriers preventing low-wage workers from advancing include deficiencies in academic preparation, language literacy, the need for financial and social supports. Leading among the workers' needs, according to the informants, were childcare and financial assistance. Second, the home health care provider characterized behavioral issues as the challenge for home health aid candidates between the ages of 18 to 26, describing many as young women with little success in the school system who find it difficult to adapt to the 3-week training program that requires them to be punctual, sit in the classroom for long periods of time, stay focused, and carry out the practical work. In the case of the foreign-born candidates, it was language and reading that proved to be more difficult. Eligibility for home health aid candidates in this program only requires a 6th grade reading level. Candidates are not asked, nor are they required, to have a high school diploma or GED. Third, the recession presents us with a different set of circumstances for low-wage workers from just a year ago. And here we should note that in October of 2008, the New York City official unemployment rate was 6.2%. And 1 year later, it is reported at 10.3%. But we know that the real rate is another few percentage points higher. Many displaced workers will be competing with less qualified and experienced, younger immigrant populations who are trying to gain entry into better paying jobs that offer benefits and stability. A decrease in employee turnover is reported among home health aides by our interviewees, while the numbers applying for training in that occupation grows. And I think Dennis Rivera this morning demonstrated that in the tables that he showed. The home health care interviewee reports that of the 10,035 candidates interviewed for training, they accepted 2,928. 3 in 10 candidates interviewed are trained and hired by the agency, regardless of whether the economy is good or bad. In 2008, this program graduated 3,500 trainees, and all of them were placed in jobs as home health aides. According to a union program informant, hospitals want only the most skilled employees, stating that they offer higher wages at about $16 per hour, good family benefits with no out-of-pocket costs, and pension plans. Hospitals then ask, why shouldn't we take the best? They are not looking to employ the recently trained person with a high school diploma, which makes the work of advocacy and building strong employer relationships all the more important. The union's unemployment center has 25,000 to 30,000 applicants each year, and there are only 4,000 jobs available for referral. One interviewee noted the existence of a cultural proficiency gap, especially in the upper occupational echelons between patient and service provider, another point that Dennis made this morning. For example, roughly 30% of the New York City patients are Spanish-speaking, and only about 4% of New York City nurses are Hispanic. Additionally, there is a shortage of Spanish-speaking healthcare practitioners in long-term care and nursing homes. And among those that were mentioned are social workers, speech pathologists, the licensed practical nurses, and the nurses' aides. The interviewee added that technical and professional occupations are real pathways out of poverty, with LPNs starting at $48,000 after completing a 1-year degree program, and registered nurses with a college degree starting at about $75,000. So we conclude with some preliminary recommendations that will be further detailed and addressed in our final report. First, strong collaborations and partnerships among key organizations play an important role in creating pathways out of poverty. for low-wage workers. And these collaborations should include industry partnerships, the unions, educational institutions, the community-based organizations, and government agencies. Second, comprehensive support offerings help to remove barriers that prevent low-wage workers from participating in career ladder programs. Childcare, mentoring, tutoring, financial assistance, transportation, offering them prep and academic skills and job skills and ESL, also very important. Third, culturally proficient remedial services and training can improve employee performance and improves patient outcomes, and that is something that is surely substantiated in the literature. Supporting employee release time to participate in career ladder programs can reinforce the success of participants. And finally, we have to address the need to support policies that improve the working conditions of the fastest growing health occupations with the lowest wages and benefits, and these include home health aides, personal and home care aides. Thank you.
Thank you very much. Our next panelist is Anthony De Jesus from the School of Social Work. His presentation is titled A Cross-Case Analysis of 3 Model Pathways Initiatives for Low-Wage Puerto Rican and Latinos into Social Work.
Thank you, Carlos. Good afternoon, and welcome to the School of Social Work, which is the site of many, where many adult Puerto Rican and Latino students are transitioning into more stable employment and careers in the human services. My paper, my first title is Abriendo un Camino. I think these programs provide different characteristics, program characteristics that would lead to a relatively I won't say obstacle-free, but a more seamless pathway into social work careers, human service careers for Puerto Ricans. Expected occupational growth in the social work sector, continued migration of Puerto Ricans to the U.S. mainland, and growth of Latino immigrant populations confirm the need to strengthen and replicate models that effectively address barriers to the development and expansion of a Puerto Rican social work workforce. According to the U.S. Bureau of Labor Statistics Occupational Outlook Handbook, social work employment will likely increase by 22% between 2006 and 2016, a rate that is much faster than average for all occupations. The growing demand for bilingual and culturally competent practitioners presents an opportunity for Puerto Rican and Latino bilinguals in areas where large population of Latinos reflect the client base. Even some high-wage Puerto Rican workers may benefit from social work services as well. These anticipated opportunities only reinforce the need to reduce barriers for low-wage Puerto Rican Latino workers in entering and climbing career ladders in social work. So I looked at three programs. One was based in the union, and Dennis mentioned it today. Within the 1199 Training and Upgrading Fund, there is the Health Careers Core Curriculum. And so this part-time program allows union members to take up to 34 credits of required college courses through CUNY and apply these credits to healthcare-related associates and bachelor's degree programs. Tuition is covered for union members who only pay for books and fees. Participants must attend a program orientation, college-bound workshop, and pass the reading and writing portions of the CUNY ACT Skills Assessment. Courses are offered on CUNY campuses, at local union sites, and online. Participants are enrolled in a cohort and are supported by case managers and counselors who provide counseling on campus and at the fund sites, assisting with course selection and referral to support services. Participants have 7-day access to program advisors. According to Ruth Leon, the program manager, approximately 30% of the participants are Latino. Actually, Rivera mentioned this morning that about 12% were Latino, and approximately 30% of the participants pursue careers in social work. The Adelante Bilingual Career Development Certificate Program at St. Joseph College in West Hartford, Connecticut was born of the shortage of culturally competent bilingual Latino healthcare workers in Hartford, Connecticut and statewide. Adelante is designed to allow working adults with some college obtain an undergraduate certificate with the goal of completing their bachelor's degree within a social worker health profession's career ladder. Courses include business and professional communication, Latino storytelling, and community interpreting and cultures. Every credit satisfies general education distribution requirements and is transferable to the 4-year bachelor's degree program, the adult college at St. Joseph College, and other 4-year institutions. It's housed in the college's Department of Social Work and Latino Community Practice. They also offer a postgraduate certificate program in Latino community practice. And this is, I think, a very innovative model for cultural competence and for non-Latino, non-Latinos and Latino heritage language adult learners interested in strengthening their bilingual skills and their cultural competence in working with Latino communities. The program provides students with affordable tuition for part-time returning students, flexible schedules that accommodate working adults, Latino faculty advisors and mentors, individualized tutoring and academic support, and classes conducted in Spanish and English, culturally meaningful curricula, and the inclusion of Latino families and communities in the college experience. The Bridge program, Building Refugee and Immigrant Degrees for Graduate Education at Boston University School of Social Work, is a 4-step program that seeks to attract and retain refugees and immigrants to an MSW program. It's a 10-session pre-admission program which is followed by enrollment in the MSW program when students who participate decide to apply, and they receive support services and mentoring throughout the MSW program and beyond. Interviews with program directors provided a deep understanding of how these programs respond to the needs of Puerto Rican workers and health and social work employers. For example, Laurie Greenhouse Gardella, the Associate Dean for Graduate and Professional Studies at St. Joseph College, talked about the Adelante program as an extension of the college's mission to provide a rigorous liberal arts and professional education for a diverse student population. Adelante's origins were in a demonstration project called Comenzamos, where Greenhouse Gardella, then the chair of the college's social work department, collaborated with 2 Latino social work education colleagues. In this program, students from the local Capital Community College attended courses or took courses on the 4-year private school campus as a goal to transition them into 4-year colleges, both at the private campus and at the local public institution. So Comenzamos was a project to encourage Latinos who were interested in social work to go on to a 4-year school and a 4-year social work program. At that time, only 9% of Latinos at the community college were getting their associate's degrees and going on. So this is how they decided to form the coalition. Adelante is in its first year and serves 10 Latino students, the majority of whom are Puerto Rican from the greater Hartford area. While too early to analyze outcomes, the program is building on the experiences with Comenzamos and the relationships established with local community college and social work employers. After receiving a $50,000 grant, ironically from the Walmart Foundation through Ed Excelencia, Walmart is known for its commitment to low-wage workers. Adelante has developed a promising and innovative infrastructure to strengthen the human capital of Puerto Rican Latino students. The Bridge program emerged from the consolidation of several decades of programming for students from immigrant, migrant, and refugee communities. Prior to this program at Boston University during the 1980s, a Puerto Rican professor, Julio Morales, established the Puerto Rican Leadership Program, which recruited Puerto Rican students to the MSW program at BU. Lee Staples, professor of practice and director of Bridge, describes the program as part of an historical commitment of the school to educate social workers from newcomer communities. He acknowledged the former dean's commitment to recruiting students of color who were best prepared And again, the emphasis was that these students from these communities would be best prepared to provide culturally competent services to their communities. While these programs traditionally served a smaller percentage of Latino immigrant students, in recent years, students born in Puerto Rico have applied to Bridge program, and although Puerto Ricans do not fit the legal descriptions of refugees or immigrants, and it was really Latino faculty and students who took the initiative themselves that created this entry pathway within Bridge for Puerto Rican students. Carmen mentioned, oh, both Carmens, right? But Carmen Torres mentioned Rivera, some of the recruitment strategies, and all programs utilize similar recruitment strategies that she mentioned. But the private institutions really, in a very labor-intensive way, focused on outreach and developing partnerships with employees, healthcare employees, large social work agencies, mutual assistance associations, community-based organizations, and this was the case within the Hartford area and in the Boston area, in terms of identifying potential students and also employers who would be able to support those students through, in the state of Connecticut, incumbent worker funding sources, which are drying up, but they think will be there in the future, and would also provide students with those support. I think one of the other themes that was really important was also the need to change the culture of higher education to be more responsive to the needs of Puerto Rican and Latino students. So Greenhouse Gardella at St. Joseph's College observes, it's hard because there's a lot of distrust and fear to overcome. If you're creating a program specifically for a population that's reluctant to go to college, that has been spurned and hurt in the past, you really need to build relationships one student at a time. So you can have your glossy brochure, which we have, and you can have your admission staff on board, but ultimately it's coming down to building these relationships one student, one family at a time. The informal piece, that's the other piece, the informal piece, when we've had breakthroughs with any of our programs, it's because of personal connections. The person knew that person at this agency, they trusted her, so they'll trust you. So one of the other areas of emphasis was support services, and the private institutions in particular, the discussions around mentoring, counseling, both academic counseling and advisement, and access to interpersonal or mental health counseling, the incorporation of families into programming in the Bridge program and the Adelante program, helping them understand the culture and expectations of higher education, and supporting their family members in that process. Also, the connections and the relationships that these established social work programs have to employers and social work agencies was another very important theme. They all provide participants with assistance in developing career development plans. St. Joseph's College, for example, I thought was the most explicit in its support in this area by making career development an explicit part of the program's name. Gardella described this in the following way, and it's the Adelante Certificate in Career Development for Bilingual Professionals. So it's very explicit about the career development, and that's how you attract adults to college. Not by saying you'll love it or it'll improve the opportunities for your children. All that's true, but what really attracts people tends to be career opportunities and advancement, and we mean it. So this program is very specifically looking at bilingual career development. Students begin by making an educational and professional plan, and then we help them to realize that plan. They improve their English and Spanish communication skills, which will help them advance in college as well as in the workplace. And and again, because Adelante is really in its first year, the only program that had any outcomes at the graduate level was the Bridge program. And the director of that program mentioned how many of the graduates of those programs, particularly in other immigrant communities, immediately become leaders and move into leadership roles and jobs in their communities, and that would likely be the case for the Latino and Puerto Rican graduates of that program. So these were some of the themes. I look forward to continuing this work, linking it to some of the work that's presented this morning, and thinking about how these program components can really be brought together with an institution like CUNY to serve a greater number of Puerto Ricans. Now, I think one of the other very important distinctions was that the HC4, the Health Careers Core Curriculum, serves, Dennis said this morning, about 500 students. These are all union members, and so if we're thinking about one of the definitions we had talked about in terms of low-wage workers was access to jobs with benefits, and so for 1199 members, they have access to the benefit of this Health Career Core Curriculum. What do we create for Puerto Ricans and Latinos who don't have access to those kinds of benefits? And so the other thing was that they're reaching a larger number of adults, and so these private institutions are very small numbers. I mean, they're 10 and 12 students a year. So how do we balance that and move things to a larger scale? So these are some of the questions that I look forward to hearing in the feedback and to continuing to research. Thank you.
To round up the panel, we have Professor Victor Torres from the Department of Africana and Puerto Rican Latino Studies at Hunter. His presentation is titled Community-Based Career Ladders in the Environmental Preservation Industry.
Buenas tardes. ¿Me escuchan bien? Más alto, ¿verdad? Hola, 1, 2, 3, probando, bien. Undeniably, the burden of environmental pollution is on the shoulders of ethnic minorities. Of the 146 million people that live in counties that do not meet the EPA Clean Air Act's quality standards, 80% are Hispanics. In New York City, Puerto Ricans are among the most affected. In fact, Puerto Ricans have the highest prevalence of asthma in the United States, 20% lifetime and 11% prevalence among children. Environmental and health inequalities are closely related to ethnicity and class, as the case of Puerto Ricans in New York City illustrates. Historically, Puerto Ricans in New York have occupied the lowest economic ladders, as some of the other presentations have already pointed out. There is a negative synergy between poor access to living wages, poor environment, and poor health. Under current political conditions, green workforce development seems to have the potential to address some of these questions. There are multiple actors, NGOs, local and national governmental agencies, and degree-granting institutions, such as CUNY, among others, as well as different initiatives, such as the weatherization assistance programs, Apollo Alliance, sustainable salt drones, that are opening new pathways for low-wage workers in the environmental sector, and they need to be studied. Well, the concept of green-collar jobs modestly circulated among environmental economists within academia. It was not until the passing of the Green Jobs Act in 2007 that the concept reverberated in the hallways of Congress and beyond. The definition of the concept is still unclear, and authors in the field have not reached an agreement. It has a problematical kinship with discussing green jobs traditionally associated with conservationists, park rangers, and other similarly white middle-class environmental sensitivities, uninterested in working-class issues. On the other hand, workforce development intermediaries associated with green-collar jobs are closely related to environmental justice movements in working-class neighborhoods. These movements emerge out of the struggle of minority groups against the pollution of their environments, of their living environments. In general terms, the concept green-collar jobs implies unskilled labor or middle-skilled labor in industries identified with energy, environmental, and resource conservation, whether in the production process or in their final products. For instance, in an attempt to operationalize this concept, Pinderhuge identified 17 entry-level green-collar sectors jobs in the Bay Area. This list included everything from bike shop repair services to planting trees. While this taxonomic approach is important for it identifies jobs that might not have been thought of as green-collar, the definition as well as its implications need to be refined. In spite of, or because of the ambiguity of the green-collar job concept, many community organizations have become intermediaries in green workforce development. Is that working fine? Uno, tres, probando. Oh yeah, it's better. So in spite of or because of the ambiguity of the green-collar jobs concept, many community organizations have become intermediaries in green workforce development. Their success stemmed from their ability to identify and match community needs of employment with the needs of emerging green industries. Training and support of the unemployed and hard-to-place workers seem to be at the core of reintegrating people into the job market. With the orchestration of private as well as governmental funds, some of these community organizations have achieved their reinsertion in the labor market of people that otherwise would not have been, could not have gone into these type of opportunities. According to McGee, what sets apart community-based workforce development intermediaries from other kinds of training programs is their close relationship with employers and with the needs of a variety of community constituencies. Because of their capacity to negotiate with multiple actors, private, governmental, local, federal, etc., community-based NGOs seem particularly well suited for this role. However, their vulnerability in terms of funding cannot be underestimated. This research proposes to study the role of degree-granting institutions such as CUNY and other organizations in the design, management, and sustainability of programs targeting low-wage workers. It also surveyed the different programs engaged in the development of green-collar jobs within New York City to document what are the best practices. Actually, I focused my research on the Bronx Environmental Stewardship program. And so I'm going to sort of do a zoom in into that particular program to sort of flesh out the specificities of this program and why it's so important to study this type of programs. In New York City alone, there are several environmental justice organizations addressing issues of environmental inequality, while simultaneously providing training and access to green-collar jobs. Of those, the most successful one, not only in New York City, but some argue across the nation, is Sustainable South Bronx. In fact, Sustainable South Bronx has been so successful that they have launched a nationwide consulting service. This program aims to help cities and other interested parties organize green-collar job resources to address civic issues such as stormwater management, public health, law enforcement, and quality of life. Funded in 2001 as a result of the environmental struggle, this program have a wide array of projects that include community outreach, youth development programs, education, green of urban spaces, and vocational training, among others. However, what has set apart these programs is the Bronx Environmental Stewardship training within the Sustainable South Bronx. Since its inception in 2003, the Bronx Environmental Stewardship Program has been able to provide training and certifications within the newly emerging category of green-collar jobs. These certifications provide vocational, and specialized training in areas as diverse as bioremediation, green roofs installation, green roof maintenance. The list goes on, and it's very up to date. They also provide other kinds of certifications such as first aid, CPR, and New York City tree planner, entry-level climbing, and 10-hour OSHA training, so on and so forth. So it's pretty comprehensive. Now, what is particularly striking about this program is their long-term success rates. Keeping track of graduates from the BEST program has shown that 85% of participants end up gainfully employed at the 4-year mark after graduation. Another 10% end up enrolled in college. As of 2008, about 150 have graduated from this program. These rates are striking for various reasons. First, participants of these programs are from traditionally marginalized communities with immense structural limitations and little skills. In other words, hard to place workers. Second, BEST is a 10-week, 8 to 5 intensive program that can be quite demanding on people already juggling low-paying jobs and family responsibilities. Third, graduates of the program are successfully placed in green-collar jobs even under the current economic recession where unemployment is skyrocketing. Dwayne, a field manager for BEST, explained his role and some of the difficulties, and by saying that I'm the point person and mentor to them. Sometimes I have to encourage them to hold on because it can be hard to see the future possibilities when you are doing work that looks like simple manual labor. Part of the environmental remediation is rubbish removal, like jumping in the river and plunging out rusty bags. But as the training continues, the students see how their place in the bigger picture will help save the planet and themselves. My job gets a lot easier. The mission statement of BEST states that they bring issues of environmental justice to the forefront of community consciousness and to begin to repair and reverse decades of environmental degradation. The BEST Academy not only connects residents of the South Bronx and other environmental justice communities to employment opportunities, but helps create an economically sustainable South Bronx. The entire community benefits from the increased number of residents who have marketable skills and can now contribute to the economic revitalization of the neighborhood. Notice how this statement is squarely linking the social and environmental well-being of the community with the creation of green jobs that are embedded within that particular locale, the South Bronx. This speaks not only the sustainability of the South Bronx environment, but also the sustainability of green jobs that are meant to address their specific problems of pollution. This grassroots green-collar job development also means that jobs stay local. There is minimal risk of outsourcing. All right, I'm gonna go quickly through this. Green-collar jobs development provides a particularly efficient career pathway for Puerto Ricans and other economically marginalized groups because this type of development seeks to improve low working skills to middle working skills. Middle working skills require more education than high school, but less than a 4-year college degree. Technical programs such as BEST provide effective training, support, and placing of participants with jobs within private and public sectors, thus paving a pathway for economic self-sufficiency. Because these jobs are middle skilled, they provide opportunities for career advancement with augmenting skills and living wages. In the process, this type of jobs not only positively improve the environment, but also positively improve the self as people develop an environmental and social consciousness on the issues affecting them. I think I'm going to leave it there just for the time's sake, but I think that we need definitely to pay more attention to these developments in grassroots organizations such as the one in the South Bronx. Thank you.
We're going to go to our discussants. Lee McCormick from Hunter College is our first discussant.
We've switched the order.
Oh, my apologies. Then Nestor Rios with the Center for Puerto Rican Studies will be coming up first. Thank you.
Thank you, good afternoon. And I'm very aware that I'm between you and lunch, so I'm going to work as fast as I can. I'm not a traditional researcher, although I have done research and I am doing research. I consider myself a practitioner. My background has been as an executive director of a community-based multi-service organization in Roxbury, Massachusetts, where I met some of my colleagues here. In that capacity, I helped manage workforce development training programs and for bringing people on public assistance, training on nurses aides, office assistants, and was able also to design a workforce development program in the mid-1990s that incorporated environmental cleanup. And we were collaborated with Roxbury Community College to do that, and became a program that was a great success. It went from jobs that we were then getting our clients at the $8 and $11 range up to the $15 and $20 range. And that program continued, and there was a great demand for it after I left the institution. I offer that perspective because I'll also be talking about perspectives generally in these papers. But what I want to do is talk about these papers, what they say about the conditions of Puerto Ricans and Latinos, and the possible role of Centro and you, its partners, in addressing it. The picture is gloomy. I mean, it's not the 1960s and the 1970s, but the picture is gloomy. We're still sort of, quote unquote, have not arrived, but at least we're here, as evidenced by our speakers and Centro's presence in this effort for close to 40 years now. What these papers said to me was really what matters most. What matters most in terms of infrastructure, in terms of how we use culture, community, the champions that we identify, and perspectives that we take. In terms of infrastructure, Professor Mercado most directly questions infrastructure, the need for infrastructure, in calling for the examination of labor market intermediaries. But whether the other researchers in their papers describe the interventions that they study as labor market intermediaries, they do describe intermediaries, whether from the government sector, private sector, not-for-profit, or academic institutions that work to bring the skills to communities and community residents. What do these labor market intermediaries do? And they do several things. They bridge boundaries. They are the sector jumpers. They are the people who are literate in what goes on in those institutions that they bring in combination to this problem. They know what's going on in the community. They know the education and the training that needs to be done. They know the government policies. The next thing that they do is they amass financial and other resources to have these organizations be able to work more efficiently at scale. The next thing they do is coordinate institutional players by utilizing their strengths and by addressing their weaknesses. They bring them to scale, as I mentioned. They help improve their management. They help with access to resources. They help with bringing child care services, health services, transportation, and other social services to their clients. They can affect policy at a level that no one of these institutions working in collaboration could, right? And they do that by helping to design programs and legislation that policymakers can use to address problems that they generally will not recognize unless there is a solution for it. Finally, they design these career ladders and usually work within specific industries. And that's important because they become the experts in the value chain of the sphere that is creating the jobs for our constituents. Typically, these labor market intermediaries work on a regional or national level, incorporating community actors in their work. So that is why I find the work of Dr. Victor Torres so inspiring. He gives us, in his paper, an example, a description of the Bronx Environmental Stewardship Training Program, or BEST. In that community, BEST has taken a long-standing environmental problems and converted them into job opportunities for community residents through training and environmental restitution within BEST's environmental justice mission, and thereby enhancing community stability. Community matters for place-based interventions. They bring important elements ameliorating the need for social and social service, family and social service interventions. They allow, when working in the community, for families to play their roles in support of workers who need to both work and train. Culture matters. We can use culture, particularly language and the unique position of Puerto Ricans and Latino students in the social fabric affecting the immigrant and other Latino communities, as a competitive labor market advantage through both English and Spanish language development and raising the cultural competence of these students. Similarly, the work of 1199 training program recognizes the cultural reality that low-income Puerto Rican and Latinos must make difficult choices between labor market participation and completing higher education. And finally, perspective matters. We need to address local labor needs within the context of global competitive demand. And I'll provide some personal illustration of that. When I was working at the New School, I had the opportunity to work with some very talented research assistants. The school had both an introductory statistics class at the graduate level and an advanced statistics class at the graduate level. I kept noticing that the RAs from Japan, from former Soviet Union countries, from Korea, would test out, not of our lower statistics class, but the advanced statistics class, and turn around without having taken any of our courses and tutor those students and become the teacher's assistants in those students. So this puzzled me. I start looking or staying sensitive to this issue. And then I come across some statistics that say that the top 10% math students in the United States in Japan would be the bottom 10%. That is the perspective that we need to have. That is what we are competing with. The other point that I'd like to make on perspective is that we can no longer, American workers can no longer compete on price. It is a fast-paced ride to the bottom of the economic ladder. No one will outcompete China and India on labor costs, but we must match them and surpass them on the massive infrastructure investments that they are making in their economy in order for the United States to stay competitive. We must compete on the basis of quality and innovation and give communities the tools that they need to do so. We need, I'm not going to be very popular with my daughter, we need longer school days, shorter summer recesses, and better pay for teachers and the people who train our adult workers. I had the opportunity to work with Ray Marshall, who some of you know by reputation as the former Secretary of Labor, and he's now the chairman, or when I met him about 2 years ago, he was the chairman of the board for the National Center for Education and the Economy, and I would recommend their work. They have gone around the world looking at what other nations are doing. They investigated 200 different countries, what they were doing in terms of supporting their workers through educational systems. And he told me something that I found quite interesting. He said that, I believe it was in Norway, that a teacher's starting salary is equivalent to the starting salary of an engineer. In US dollars, $70,000. He also told me a story that in Germany, because of their strong apprentice infrastructure, you cannot become an electrical engineer until you have been an electrician working in the field. Now, that might have something with the fact that Germany is one of the largest exporters in the world. And for Puerto Ricans and Latinos to prosper, we must have a growing economy that creates the products that the world demands. So what does this mean for Centro and its partners? We must maintain perspective. We must identify and take up the mantle of champions. We must build where we find our people, and that's from the community up. We must appreciate the richness of our Puerto Rican and Latino cultures and use it appropriately to our advantage. And finally, we must support, in whatever way necessary and possible, the building of the infrastructure needed to move the social, economic, and academic condition of Puerto Ricans and Latinos forward. I hope that at some point you will be able to read their full version of these studies and see in them the promise that I saw. Thank you.
For the second commentary, we have Lee McCormick.
Hello. I guess I'll take this out. Well, after that inspiring ending, Nestor should have gone second, I think. I'm not sure I'm going to be quite so inspiring. In fact, I'm going to be a little more critical of what was missing in the papers. But anyway, that was terrific. I think both of us, in some regard, we both read all 4 papers. And therefore, our comments really kind of go to how they go across the papers rather than individual papers. And partly this is due to the fact also that several of the papers are still in process of doing their interviews, and I think we're looking eagerly for the results, which I think I might anticipate. There were some that were finished, especially the one Anthony's was completed, I guess, with all the interviews, yes, but so it sort of portends what the others might find. What's interesting is that all of these 4 papers take the same method and the same research plan, probably intentionally. I don't know if you've discussed that. Essentially, we're picking occupational areas that have job growth potential. We're figuring out that there aren't Puerto Ricans and Latinos in those job categories. Nevertheless, some of the clients of these job categories could benefit from having culturally competent people in those job categories. Then we're all looking at best case practices of models of educational programs that have allowed Puerto Ricans and Latinos to enter these job categories. And then the papers aspire to tell us what are the key features of these best practice models that make them all successful, and how can we replicate them in New York, possibly involving CUNY, and I look forward to those responses, possibly involving colleges in general. And so what I was intrigued with was, and I know this isn't the mandate of your papers, but once you finish them, comparing across them I think might be quite interesting. And I know this isn't the intention of your papers, but perhaps of a common paper after that. So I guess I'm particularly interested, several features were indicated as possibly important within each of the papers. Leaders, highly motivated institutions, support services, things like that that will get people into these, through these educational programs and staying with them. I'm curious, when you're all done though, are there differences that may speak to the different industry settings that these jobs are within? Are there, different
industry barriers or to advancement or peculiarities that may change the kind of support services or other general findings that you'll find out about what helps low-wage Puerto Rican and Latino workers to advance in these career paths. And so that's just I guess I'm curious to go beyond your papers when you're done. I should say I teach in urban planning, and I do teach about workforce development, so I want you to go beyond for my own sake so I can use it in a class, I guess. The other thing is, so I have 5 points. My second point is that all of these papers aim to draw lessons for colleges, and yet they haven't gotten that far. There was an interesting comment in one of the papers that our college model, the traditional college model, is outdated, especially for the kind of workers we're talking about here. I teach graduate students in urban planning, many of whom come from families that it's normal to go to college. And even in that regard, the traditional college model, which assumes that we're all only attending college with no other familial or much financial responsibilities, really doesn't hold true, especially in New York. We have students that work full-time, and they keep trying to take full load of courses, and I keep telling them they can't do that. So I think as you actually find out what new college models could be pursued, especially for the populations you're talking about, I think there could be broader lessons for all of us in college in general, because we're not in the same world we were when I went initially to college, and even then I worked my way through as well. So it's a different college atmosphere. So I look forward to those comments about, and especially CUNY, how we could change what we're doing. Let's see, my third point is that the silent variable here for me was gender, and it's there, and people sort of mention it, and I think in Ann and Edwin's earlier paper, it came out quite striking, yet it's not explicitly discussed. And we're interested in a particular ethnic group and how it compares to other ethnic groups in our U.S. economy, but there is this giant gender thing happening in these occupations and also in the data about Puerto Ricans. And I just wondered if you could, maybe in your interviews as you go along, I don't know, ask some questions or try to insert it more explicitly into what you're doing. Are there particular barriers that women face versus men, or that men face versus women? Obviously, there might be differences in familial responsibilities, but it could go both ways. And I think just finding out, do the programs have to offer different support services for one versus the other? Right now at Hunter, we're in the process of maybe getting rid of our child care center here, which is quite important for some people who work and have families. But I think, again, inserting the gender role. Nestor and I were talking about this earlier. Some occupations, of course, are feminized, and its education leads to higher wages, but sometimes there's other factors that lead to lower wages, meaning it becomes a sort of a gender, what do you call it? Trap. Or we know women are paid less than men. Anyway, and this partly gets to my fourth point, which is, and I think it's because I teach this as well, career paths, and Ramon pointed out in his slides that there are many different ways, strategies to think that labor market intermediaries have to getting low-wage workers into better jobs, and career paths are one of them. All 4 papers are taking that career path strategy and trying to document it and encourage it within different industries. But only one of the papers gets to the limitations of this approach. And I guess, and this is the healthcare paper, and I guess perhaps because you know that some of the jobs that are fastest growing are not great. I mean, I was looking at your numbers you passed out. Home health care aides still get paid $10 an hour, which is better than minimum wage and better than the garment industry. But yet, if you know anything about those jobs, they're extremely difficult, back-breaking work, and very insecure, and they're not, the job conditions aren't great. I know SEIU it has, as a union, the motivation to change the job conditions, so they do some organizing around that. But I guess I would challenge and your paper also mentioned the recession. I think yours is the only paper that really talked about that. to think about larger structural features and how they might impact your career path model in the future. And these structural factors could be related to the industry and how it's evolving. I guess I don't know enough about education, but we all know that with the recession that, well, in my town of New Rochelle, they're laying off teachers, and I'm sure they're doing it here. The movement to smaller class sizes, I would assume, is going to go the other way. And I guess we can talk about what's happening at CUNY, lack of resources. So just knowing these structural factors within the recession and so forth, what other ones? Job quality issues of the different parts of the career ladder within each of your industries would sort of fill out what you're advocating and give us a better understanding of what the road might be for an individual going up these career ladders and how it might change in the future. I think your papers also will be informing the labor market intermediaries that are going to become the industry specialists in your area. So because you know the industries better, adding that extra information about how the industries and the job quality of different jobs in those industries would help inform the, would help inform those labor market intermediaries. So I would add more of the sort of background of that. And then I have one final point, which was this whole notion of bilingual career development, which is what I guess Anthony said, but basically all 5 papers point to these sort of untapped advantages that low-wage Puerto Rican Latino people have in serving these occupations, that because they're bilingual, because they're culturally competent, that they actually are preferable as workers. And I thought that was just striking because they're not in these occupations, yet they're preferable because they bring these characteristics. And so it's a matter of just, ramping up the education and getting them in there. So that piece was really very interesting to me. So those are my comments. Thank you.
Thank you.
Thank you.
In the interest of time, what I propose we do now for this Q&A period is that we take 3 questions from the audience before we have move on to the answers. So I see 1, 2, and 3. Sir?
I was curious that there was no mention, at least in discussions, I haven't been able to see the papers, of the so-called cliff effect. That is, when you try to advance yourself, you reach the edge of a cliff where you lose your housing support or you lose your child care support. And indeed, in Massachusetts, some research has shown that when you move from $8 to $16, you don't make any gain whatsoever because you've lost all your social support. And the way our social supports are structured, and this will be worse with the new health care programs that subsidize you if you're poor, and then you lose it as you go up. And what kind of barrier this provides or establishes in all the programs that you've been talking about. I'd be curious to hear ways that might be addressed.
Thank you. Question number 2?
It's not a question, just I would like to see that we could take a look at the relationship between Puerto Ricans and the healthcare and environmental industries here in Puerto Rico and other parts of the world.
Okay. Number 3.
My question is if you've stepped or have looked at the role of collegiated professional associations, like the Association of Social Workers, Association of College of Pharmacists, and so on, because they seem to be playing a very important role, allowing entry into specific occupational categories. Specifically, for example, I observed that in the context of allowing immigrants into the health sector.
I'll respond to both questions. I did contact the Latino task force group within the Council on Social Work Education prior to the annual program meeting last month. I sent an email out to the listserv for asking for support in identifying programs that might fit the criteria for this study. And there was very little response. I did get response from people who also had interest in developing such programs. So that's not to say that there aren't programs out there. And I know certainly in the Southwest, certainly in Arizona in particular, they have social work and Latino projects and in Denver, but I haven't had. Most of those are looking at the graduate level, and so I think that there is work, but it's incomplete, and I think it's brushing up against some of these industrial challenges. In regards to the cliff effect, I think it's a very important potential effect, and one that I want to get under. Just anecdotally, having a conversation with a participant in the conference earlier, she said to me, I have a bachelor's degree, but the potential jump in salary with an MSW is not lucrative enough for me to make the investment for the opportunity cost. And so I mentioned to her that may be true for you as somebody that went through a bachelor's degree straight through after high school, but that these pathways are really targeting, I think, those adults who are over 25 with some college and no degree, and I think that there may be other loss of supports that those individuals have to really assess in making their decision. So there may be built-in disincentives there. I think that to some degree the opportunity with these smaller programs is to go back and interview some of the participants and understand what's the cost-benefit analysis they've made in pursuing this, and then also interviewing graduates of these programs and get a sense of what the benefit and the outcome has been.
I guess we'll take that point about the disincentives of increasing wages as part of it. Hasn't been referenced as far as I recall from any of the interviews, but it's certainly part of the contextual argument, right? The policy changes that have to be looked at if we're going to, if these programs are going to make any difference in the lives of people. It's kind of like stage 2 of welfare reform. You have unemployed to employed, but really doesn't make much of a difference in their lives. Now we're going from low skill to not so low skill. What is the point? We're just in that rat race that the system has set up here, and that can really only be addressed from the policy and social action side, I guess, but it should be mentioned.
In many instances of the interviews that we had, you're looking at, in the home health aid case, for example, these are people who are not just working within one agency. They're probably working in many different agencies just to make up hours and wages. And part of that reason is because of the changes in Medicare's reimbursement rates and their caseload, which has been lowered. And so if it's lowered and you're only working a 4-hour case at $10 an hour, then you're going to have to look for another job. So it is a cycle. It is a vicious cycle. And you have many young people who, as I gave in the numbers, when you have an agency that's looking at over 10,000 people who are applying, many of whom are in that 26 and above, and then they only take 4,000 of them. It is a vicious cycle. So it is something that we're going to have to look at a little more carefully.
Did anyone see the article on Fordham Road? They opened up a, what is that? Applebee's. They announced 120 jobs that they were hiring for. 6,500 people applied for them from the Bronx. That's how desperate the situation is out there.
Well, I wanted to thank the panel for their presentations and the discussions for the commentary. Please give them a round of applause.